busiest organ in our body by ego is brain.
ಅದಕ್ಕೆ ಹೆಡ್ ವೇಟ್ ಜಾಸ್ತಿ ಅಂತ ಹೇಳೋದು ಅಲ್ವಾ?
Seizures means like this big seizure.
Correct.
This generalized tonic-clonic seizure, what we call.
That's the only thing they think is seizure. Epilepsy, fits, seizures. There's so many different words that is there. Are they all the same?
Commonly we call it as fits in English, or in Kannada we call it as murcha roga. In Sanskrit we call it as apasmara. In Malayalam we call it as janni. Okay. In case of Hindi we call it as mirgi or dimag ka daura. And depending on the different area, the different name is given. Okay. Seizure, it is a Greek word meaning to take possession. It is not a mental illness, it is a neurological disorder.
That's an important thing. It's not a mental illness. A lot of people put it on psychiatry, mental illness.
We see most commonly in Bangalore, Mandya, Mysore area something called hot water epilepsy.
Hot water epilepsy?
Yeah, hot water epilepsy. Disney.
I also used to be scolded, hey, don't daydream. Look at this and that.
That is correct. Okay, all daydreaming is not safe. In seizure, the accidental injuries are very common. If seizure occurs in the wrong place, you end up, I wanted to become Kannada teacher.
Kannada teacher? Are you serious? Howda?
ಅಜ್ಞಾತವಾದುದನ್ನು ಅಭಾವವೇನೆ ನಾಸ್ತಿಕನು, ಆಗ್ನೇಯವೆಂದು ಕೈಮುಗಿಯ ಭಕ್ತ, ಜಿಜ್ಞಾಸೆಯೆಂದು ಪರಿಕಿಸತೊಡಗಿ ವಿಜ್ಞಾನಿ, ಸ್ವಜ್ಞಪ್ತಿ ಶೋಧಿ ಮನಿ ಮುಂಕುತುಮ್ಮ.
You want to beat the AI, get AI proofed, become a neurologist. I remember one lady had 300 tapeworm larvae. 300, you put on the scan like starry sky.
And some people will tell deja vu phenomenon. We use normally deja vu. Suddenly I feel I have seen him multiple times.
Familiar people are looking familiar to you.
Jamaisuva phenomenon, Dr. Sharan sir, I know you since more than 8 to 10 years. Suddenly I feel I don't know who this fellow is, a new face to me like this. I will be. That's called Jamaisu phenomenon. It is the most evolved brain of animal kingdom. It can do wonders. At the same time, it can do blunders. Seizure is the stigma attached and social discrimination is very high. 75% at least go to medical care. 25% may not go to medical care. When they'll go to religious places.
What are the normal tests you do to diagnose whether a patient has epilepsy?
Suddenly, burst of electrical activity generated in left motor cortex. What will happen exactly? Then I will go like this because hand is involved.
Every patient tells us a story.
Seizure is the one thing in medicine. It depends on history.
Mathematics induced epilepsy or something like that. What is that? You have this usual 3 trimesters, first, second and third. In these 3 trimesters, when is the seizure risk the highest? What Dr. Shreedhar is trying to say and what I am also trying to say is, why do you have to be overcautious, guys? Because like he said, one seizure can kill you. Keychain, they pick up a keychain and they give it in the hand. Thinking that the keychain will stop seizure. And people even today, educated people, are putting a keychain in people's hands.
Podcast is always to increase the awareness.
Correct.
We are not guiding in self-medication.
Absolutely.
You have to meet the doctor and take proper advice them. You have to tell your history. He has to examine. Don't do any self-medication. First thing. Second thing is, don't discriminate the patient who are having epilepsy. Okay. Third thing is, in time, you meet the doctor, whichever the specialty you want, whichever the system of medicine you want, you meet them and take advice from them. Okay. Don't end up in accidental injury and don't risk your life.
ജ്ഞാനാനന്ദമയം ദേവം നിർമ്മലസ്ഫടികാകൃതിം ആധാരം സർവവിദ്യാനാം ഹയഗ്രീവം ഉപാസ്മഹേ ആധാരം സർവവിദ്യാനാം ഹയഗ്രീവ ഉപാസ്മഹേ ഹയഗ്രീവ ഉപാസ്മഹേ.
Rebooting the brain, powered by PRS Neurosciences. Whenever you have the GTCS, the seizures are happening, they want to keep, keychain, they pick up a keychain and they give it in the hand. Thinking that the keychain will stop seizure. And people even today, educated people, are putting a keychain in people's hands.
Keychain is not going to stop seizure. Okay, education about a seizure is the one which is going to stop seizures.
But tell them, stop doing this kitchen.
Yeah, there are so many myths I told you now. The one of the myth is whenever they are having seizures, if they hold keychain or iron content, it will subside like that. They are having it's a myth. Okay, it is in common in South India. In North India, where I did my MD medicine, there they commonly use shoe smell. They use sock. Yeah.
Really?
Yeah, shoe smell and sock smells. They will take a shoe or socks, they make them to smell. They will take onion and make them to smell. Okay, it depends on the different area. It may be different.
Culturally.
It is culturally it may be different. In South India, most commonly they will give key. I want to tell you, one patient came with an iron ring in the hand. My seizure patient. I asked him, "Why you are wearing this iron ring, man?" Sir, everyone will give key. That's why I am wearing iron ring only. Then I told, "To see, man. If it is like that, then I would have given keychain for everyone."
Everybody.
Like that became very viral at that point in social media.
Correct.
He was staring at some point. Okay, started to turn the head towards one side like this. Then he started to turn his body 360-degree direction.
Correct.
Then he moved a little bit towards his right side with hand like this. Hand fell down. Okay. So it is a type of seizure we call in our neurology gyratory seizures.
Gyratory seizure.
It is called gyratory seizures. Okay, seizures means like this big seizure.
Correct.
This generalized tonic-clonic seizure, what we call.
That's the only thing they think is seizure.
Knowing about the seizures, okay, is very important as a public. We tell knowledge, attitude, and practice.
Knowledge, attitude,
and
practice. Got it.
If you know about the seizure, how it occurs, then only you can help that person.
Ellargu namaskara. Welcome to another episode of Rebooting the Brain. And today we are going to talk to an unbelievable neurologist. But before I introduce you to him, or him to you, sorry, we will have a couple of housekeeping rules. Number one, I know all of you are enjoying our content, so please make sure you subscribe to our channel for those who haven't subscribed yet. Please share these videos and all other videos on our channel widely. You never know who can be benefited. Press the bell icon and then also the like button, and definitely share any of your thoughts, especially if you want us to create a specific content. But I am very sure this kind of quality content on neuroscience is hardly available anywhere on this social media or on the internet. Okay, and as usual, I will start with my shloka. Om Asato Ma Sadgamaya Tamaso Ma Jyotirgamaya Mrityorma Amrutam Gamaya. Om Shanti Shanti Shanti. This shloka has been a major inspiration for me from my childhood. And as the shloka says, from ignorance to enlightenment, from darkness to light, and from death to immortality. You can use these phrases anywhere in your life, personal, professional, anything else, and add your own way of interpreting these things so that you can become a better human being and a more productive human being. Hi friends, I am Dr. Sharan Srinivasan. I am a stereotyptic and functional neurosurgeon from Bengaluru, India. Today we have a guest, and he is a colleague of mine in my hospital. His name is Dr. Shreedhara. And Shreedhara is a neurologist, and not only is he a neurologist, he has a very special interest in epilepsy, or he is an epileptologist with a special training in postgraduate fellow in epilepsy. So Shreedhar, welcome to our show.
Thank you, sir.
Thank you so much for coming. And as you saw that we started this video with the CCTV footage of this policeman on a railway platform with that goods train running. He seems to be quite all right, and suddenly he starts turning in some direction, and before anybody realizes, he falls onto the train and dies. What was going on? Was it accidental, or what was that? Can you tell our viewers what went on there?
Yeah, this is one of the video which was became very viral at that point in social media.
Correct.
So when you see that person, he was staring at some point. Okay, started to turn the head towards one side like this. Then he started to turn his body. He rotated in 360 direction.
Correct.
360-degree direction. Then he moved a little bit towards his right side with hand like this. Hand fell down. Okay. So It is a type of seizure we call in our neurology gyratory seizures.
Gyratory
It is
seizure.
called gyratory
Whoa.
seizures. Okay, so normally in our public or common people, okay, non-medical people, okay, seizures means like this big seizure.
Correct.
This generalized tonic-clonic seizure, what we call
That's the
big
only thing
seizure.
they think is seizure.
This is only type of seizures. We are having so many types of seizures. You are not able to identify if you are not knowing about that thing. It is very important. Knowing about the seizures, okay, is very important as a public. We tell knowledge, attitude, and practice. If you know what is seizure,
Knowledge,
then
attitude,
and
practice. Got it.
If you know about the seizure, how it occurs, then only you can help that person.
Correct.
Okay, need not to be a doctor to help that seizure patient. Even the onlooker can help them. Okay, so the thing is, you would have seen here, because his seizures was not commonly seen seizures. So okay, in the railway platform, so many people are there. If you would have had generalized tonic-clonic seizures like this, he would have done, he would have fell down. Somebody would have come and
To his
rescued
help.
him, and
Correct.
he would have taken him to safe place. But here, what has happened? Even the people may be there here and there, but nobody would have noticed him. They would have thought him is just turning and is seeing the train is coming or not. He is seeing or he is observing some people. They would have thought that thing. Only after he is falling down, the people noticed him.
Absolutely. What a tragedy that was.
That's
Real
why we
tragedy.
tell. So in seizure, the accidental injuries are very common. If seizure occurs in the wrong place, you end up in life.
Which happened here.
Which happened in here.
So
that is very important.
Very well said. Very well said. Thank you for that explanation. We'll go back into details of the types of epilepsy in a while. But let us educate our viewers, global viewers, epilepsy, fits, seizures. There's so many different words that is there. Are they all the same? Are they different? Let us start with that first. Let them know what the word is.
Yeah, we call in commonly we call it as fits in English, or in Kannada we call it as Murcha Roga. In Sanskrit we call it as Apasmara. In Malayalam we call it as Janni. Okay, in case of Hindi we call it as Mirgi or Dimaka Daura. And depending on the different area, the different name is given. Okay, seizure, it is a Greek word meaning to take possession of. Because when seizure happens, in most of the seizures, they will lose awareness. And there are some seizures are there, they won't lose awareness.
Correct.
So he is losing awareness. What happened to him that he don't know.
He doesn't remember.
He doesn't remember. He is amnestic for that event. Okay, that is to take possession of what happened.
That means
to him.
somebody else is taking control.
Sometimes somebody has taken his control. It's a cultural belief. Okay, that's the myth. It is attached to epilepsy patient most of the time.
Correct.
The seizure is a single event. Okay, epilepsy means if two seizures occur 24 hours apart without any antecedent cause, then we will call it as epilepsy. Epilepsy is a neurological disorder. It is not a mental illness, it is a neurological disorder.
That's an important thing. It's not a mental illness. A lot of people push it on psychiatry, mental illness, booth, breath, all of those
things. Stroke is a neurological disorder. Multiple sclerosis is a neurological disorder. Similar to, example, diabetes is a one disease. Similar to that thing, epilepsy is also one disease which can be controlled with medication. We are having so many innovations in treatment of epilepsy. They can have normal life also. Epilepsy, either two seizures 24 hours apart. Other than that, if one seizure has occurred, sometimes we call one seizure also epilepsy. If second seizure occurrence chance is more than 60%, then we can call it as a epilepsy. Example, we see most commonly in Bangalore, Mandya, Mysore area something called hot water epilepsy.
Hot water epilepsy?
Yeah, hot water epilepsy. Bisnero. Okay. When they pour hot water over their head, okay, they go on pouring hot water. They will have some happiness. Finally, they will pour on, go on pouring. Finally, they will lose consciousness. Sometimes they will end up in seizures. Okay. If he is having one seizure, if he takes hot water head bath again in future, again he is at risk of having second seizure. Even though he had one seizure, per seizure, we will label it as hot water epilepsy. Here the risk of recurrence is more.
Hot water epilepsy.
Okay. So and there is some stimulus sensitive epilepsy, apoptic stimulation.
We'll come there. We'll come to that. Yeah. Before we go down to those things, I want to ask, apasmara, you said is a very Sanskrit word from Allah. What is this apasmara? How do you, is it connected to Shiva, Lord Shiva by any chance, or what is going on here? Where is the connection?
Yeah. So, you remember, Jatata Viga Lajjala Pravava Pavitastale Galevalam Velambitam Bujanga Tungamalikam Damad Ninadavad Damarvayam Chakara Chenda Tandavam Tonotuna Shiva Shivam. What do you remember? It is a cosmic dance of Shiva.
Correct.
When you see Lord Nataraja, okay, he is in one posture and he is standing on single leg. Okay, if you observe his leg carefully, there's a one dark demon is there below
Correct,
that leg. Is
correct.
stamping that person.
Correct.
His name is apasmara.
Oh,
Okay.
I see.
So there are so many stories about apasmara.
Ah.
This I felt it is more relevant to our epilepsy.
Perfect.
That fellow is apasmara. Apasmara. Smara means memory. Apasmara means loss of memory.
Ah.
What happened to him he doesn't know. It is ignorance. Okay. So ignorance is immortal. Okay. Ignorance you cannot kill. Shiva is doing Tandava on him and he is suppressing him. He is stamping him with his leg. But he cannot be killed. Okay. Once humanity is full of ignorance, they went to Shiva. Shiva did Natyam and he suppressed that fellow. Okay. It is a Natya is a constant physical and mental effort. If you want to gain a knowledge, you have to put physical and mental effort. Then only you can suppress ignorance.
Correct.
Otherwise, ignorance will occupy you. Okay, you will become illiterate.
Same the sloka I said in the beginning is the same thing.
Yeah,
Correct,
same
correct.
thing. So the thing is, aptly said, seizure is called apasmara because the false belief, the ignorance among the community about seizure is very high. If you take any disease, people talk about diabetes, the people talk about hypertension, people talk about
And
cholesterol.
not without any upset.
Without any
Some of them are proud.
Yeah,
They just have
if you
BP,
are
sugar,
diagnosed
paralla.
with diabetes, they will call to their friends. Arey, ಇವತ್ತು ನನಗೆ diabetes ಅಂತ ಗೊತ್ತಾಗ್ಬಿಡ್ದಪ್ಪ ನಾಳೆಯಿಂದ ವಾಕಿಂಗ್ ಮಾಡ್ತೀನಿ ಯೋಗ ಮಾಡ್ತೀನಿ
Correct.
dietary modification ಮಾಡ್ತೀನಿ they will tell that thing. But in the patients who are having seizure, very difficult to, they won't tell, they won't reveal also. I have seen couples, they are married for 5 years, 10 years, without knowing to spouse, they are taking the medication without revealing. Because risk of rejection, because it's so much
Yeah,
myth.
I agree. Many people
Yeah,
come
yeah.
to me, sir, madhve settle ಆಗ್ಬಿಡಿದೆ. So
Ah.
should we tell?
Yeah, so
ಮದುವೆ
much
ಆಗಲ್ಲ ಅಂತ
myth
all those
attached to the epilepsy. Okay, that is whatever the ignorance is there. Epilepsy is like any other disease. Okay, you can have a normal life with epilepsy. So that ignorance we
That
have
is
to.
very important. You can
that-
have a normal life with epilepsy.
Yeah, that podcast, the main aim is that whatever the apasmara, that ignorance is there regarding seizure, we have to take it out.
Take it out.
Okay.
Perfect.
And the patient with seizure should openly speak about seizure, and caregiver also accept them. And we have to
And the
create
community, the society has to accept.
society should not discriminate them.
Correct.
Okay.
Discriminate. I think
Yeah,
that's the better word
because
to use.
the problem with the seizure is the stigma attached and social discrimination is very high. So that's why we call something called treatment gap. Treatment gap means if you are having 100 seizure patient, especially in rural area, out of that 75% will not reach the medical
Really?
service. Yes.
75%?
75%.
My,
There are
why?
so many studies has been done in India, so the percentage will be varies. But in rural area, the misconception myths is very high. 75% will not go to medical care.
75%?
Yes,
What a
75%.
tragedy.
Because if they once go to medical care, people will come to know that thing. Okay, if they are taking medication, they will be other people will be knowing because they are taking medication. At least in urban area to some extent because of education. The treatment gap, out of 100 people, 75% at least go to medical care, 25% may not go to medical care. So in rural area, especially, it is very common. Okay, many people will go for traditional treatment. They will go to religious places. So ending up in more and more seizure.
I think after having interacted with you, and all the other many neurologists, one is them because of stigma. They may also be, many of them, like this gyratory seizure, they may not even know it's an epilepsy. They may go to psychiatry, they may go Maya, Mata, all of those things because they don't even know what is going on.
Correct.
So it's our job today to demystify, put it systematically, step by step, so people understand, oh, this also may be an epilepsy. Better to meet a neurologist, find out what's happening. And remember one thing, if you are suspect any neurological disorder, please go to a neurologist. Many of the other physicians will not understand this. So you have to come to a neurologist, a neurology hospital, where they will be able to help you. So now that we have got a good introduction to seizure bar epilepsy, now can you tell us grossly how do we as medical specialists divide epilepsy or categorize the types of epilepsy?
See, can I show my?
Yes, please.
Yeah. See, whatever I'm having in my left hand, it is the most evolved brain of animal kingdom. It is having more than 100 billion of neurons and trillions of synaptic networks. Okay, it can do wonders. At the same time, it can do blunders also.
Correct.
You see, so when come to human brain, if you take human brain, size is 2% of your body weight. Example, I'm weighing 70 kg. It weighs around 1.4 kg. Size matters? Yes, size matters. If you take body with body weight and the ratio of the brain, human brain is bigger than any other animal brain. Example, if dinosaur weighing 14,400 kg, its brain will be around 70 to 80 gram only. So it will only 0.00 some 0% of its body weight. So we are the one who are evolved so much. So in Mankutimmanaka is called Kannada Bhagavad Gita, written by D. It tells ರಾವಣನೇಂ ದಶಶಿರನು ನರನು ಶತಶಿರನು ಸಾವಿರಾಸ್ಯಗಳನ್ನು ಒಂದರೊಳಗಡಗಿಸಿಹನು ಹಾವಾಗಿ ಉಲಿಯಾಗಿ ಉಲ್ಲೆ ಕಪ್ಪೆಯುಮಾಗಿ ಭೂಮ್ಯೋಮಕತಿಶಯನು ಮಂಕುತಿಮ್ಮ. What is the greatness about Ravana? He was having 10 heads. But as a human being, as a human brain, in this brain you are having 100 heads. Each head is having 10 thoughts, 1000 thoughts are there.
Correct.
Each animal is having only one behavior. Tiger will be having roaring behavior. Fox may be having cunning behavior. All the animals' behavior is embedded in this thing. Arishadva, what we call Mada, Moha, Masara, Kama, Loba, everything is there, this thing. It can do wonders.
Interesting.
Okay. So, this is brain. Okay. So, when come to subject, okay. So, you see, whatever I am having, this is called, these are called lobes of the brain. Okay. We are having 4 lobes: frontal lobe, parietal lobe, temporal lobe, occipital lobes. Okay. Frontal lobe is the one which defines who I am, who is Dr. Shreedhar, who is Dr. Sharan. The personality, execution, judgment, abstract thinking, everything depends on this lobe.
Correct.
So, if seizure, what is meant by seizure? Next question. You say, I am speaking with Dr. Sharan. Sharan is seeing me and he is nodding his head. Everything because of electrical activity inside the brain. It is an interplay of neurotransmitters. Set up neurons are activating, set up neurons are inhibiting. Then only we do coordinated smooth movements like this.
Whenever it's a mixture of inhibition and excitation.
Yeah.
And it's a dynamic process.
It is a dynamic process.
Very true. Very true.
Whenever electricity flows in the wire, it is always at risk of short circuit.
Correct.
If wiring is not proper, it is at always risk of short circuit.
Absolutely.
What is meant by what is seizure? Seizure is nothing but abnormal burst of electrical activity inside the brain. Normally we are having electrical activity, but it is abnormal burst of electrical activity. It depends on which area of brain is involved. Your clinical manifestations will depend.
Andre, now what do you mean by that? Which area of the brain clinical manifestation? Give an example.
Example I will give.
Then you can go back so that they'll understand what you're saying.
Yeah. Example, our hand and leg, the voluntary control is stored in the frontal area. We are having something called motor cortex.
Correct.
If there any abnormal electrical activity occurs in that thing. Okay, example, imagine if I want to lift my right hand, my left motor cortex has to activate, impulse has to go to spinal cord, then it has to come to peripheral nerves, then it has to come to muscles.
Because left brain controls right side body, right side brain controls left side.
So it is a controlled activation.
Correct.
Suddenly burst of electrical activity generated in left motor cortex. Okay, it was not needed, it is not in controlled patient. Then what will happen exactly? Then I will go like this, because hand is involved and beside the hand there is a face area is there, leg area is there, the electrical activity is spreading, then I will go for seizures like this. It is uncontrolled activation. Okay. So if it is occurring at one point, then we call it as focal seizure.
Correct.
If it is simultaneously occurring in both the hemisphere, okay, then we call it as generalized seizures. Okay.
That's when you lose consciousness.
That's why when we lose consciousness.
Correct.
Okay. That's why in focal seizure we tell second classification will come. Focal seizure with loss of awareness, without loss of awareness. To lose awareness, the electrical activity has spread to both hemispheres.
So what is, just to pause you here, what is the difference between loss of consciousness and loss of awareness? Can you tell our audience?
Yeah. You see, loss of consciousness and loss of consciousness means what? Coherence of self and surroundings is a definition of consciousness. We are using interchangeably consciousness and awareness. Okay. See, what is happening to him at that time is not able to remember. That is called loss of awareness.
And he's not even in connection with the environment around him. No?
Yeah,
he's in his own, on there local.
He is in his own world. Okay, he is in dreamland.
Correct, dreamland.
Okay.
Correct,
okay.
whatever land.
Yeah. So, whenever patient is having seizure, the clinical manifestation, how he behaves. Okay, there are two things in behavior. Together we call it as semiology.
So semiology, you are used a new word now. So semiology is the language the seizures speak.
Yes.
Alva?
Yeah.
So what is this SEMIOLOGY? This is called semiology, not Shaviye semiology. Yes, tell us what semiology is.
Semiology is, it has two components. One is called, we call aura, A-U-R-A, aura. Second thing is called ictus.
Correct.
Aura is the sensation felt by patient just prior to onset of seizure.
Example.
Example, I am having temporal lobe epilepsy. Imagine.
Which side of which way is
Temporal
temporal?
lobe is this is the temporal lobe.
The small fellow.
Is small fellow is a temporal lobe. Even though he is a small fellow, play a big role.
Big role. Correct.
Because whatever your memory is there, short-term memory will be converted into long-term memory by that fellow only. If he is not working, then you will end up in dementia.
Correct.
Okay. Even though he is a smart fellow, he is a small fellow but smart fellow.
Smart fellow. Correct.
Okay.
Correct.
Okay. If any seizure is coming from, you are having that medial part, this inner part of the temporal lobe. Yeah, you can see here. You can separate that. You can see this is called hippocampus. Okay. If any seizure comes this area, it is coming from this area. Many people have subjective sensation. People will tell, sir, घबराहट हो जाते आने के पहले. That means they will have fearfulness. ಭಯ ಆಗ್ತದೆ. The fearfulness. And some people, sir, when kerosene smell ಬಂದಂಗೆ ಬರುತ್ತೆ sir ಮೂಗಲ್ಲಿ. I will have some kerosene smell. Some rose smell ತರ ಬರುತ್ತೆ sir. ಆಮೇಲೆ ಸರ್ ಹೊಟ್ಟೆಲ್ಲಿ ಗ್ಯಾಸ್ ಹಿಂಗೆ ಎದ್ಬಿಟ್ಟು ಹಿಂಗೆ ಮೇಲೆ ಹೋದಂಗೆ ಆಗುತ್ತೆ ಸರ್. ಐ ಆಮ್ ಹ್ಯಾವಿಂಗ್ ಸಮ್ ರೈಸಿಂಗ್ ಸೆನ್ಸೇಷನ್ ಆಫ್ ಗ್ಯಾಸ್ ಇನ್ ಸ್ಟೊಮಕ್ ಸರ್. ಬೈ ದ ಟೈಮ್ ಇಟ್ಸ್ ರೀಚಸ್ ಮೈ ಥ್ರೋಟ್ ಐ ವಿಲ್ ಲೂಸ್ ಕಾನ್ಷಿಯಸ್ನೆಸ್ ಸರ್. And some people will tell deja vu phenomenon. We use normally deja vu. Example, the cameraman is there, he is new to me. I have not seen him previously. Suddenly I feel I have seen him multiple times. I have interacted with him like this. That is the sense of familiarity.
Unfamiliar people are looking familiar to you.
Yeah. Jamai-Suva phenomenon, Dr. Sharan sir, I know you since more than 8 to 10 years. Suddenly I feel he is not, I don't know who this fellow is, new face to me like this. I will feel this is called Jamai-Suva phenomenon. Okay, so these are the subjective sensation, what patient is feeling. Objectively, that whoever is watching that person, he may not able to detect that
Understand
thing. all these things. Only the patient will feel. This is called aura. Aura means whenever barish ho raha hai kahin pe, the smell will get water, that rain
That's
smell.
That's a nice example.
Yeah.
So from the smell, you know, you know it must be raining somewhere.
So the example we are in sitting here, it is somewhere raining is happening. Just 300, 400 meters, we'll get the smell.
Correct.
That is aura.
Or the coffee smell of cafe coffee day.
Yeah. Ictus is clinical manifestation. Whether he is doing any abnormal movements, or he is moving out here and there, or he is doing some abnormal movements of the hands and legs, or he is doing his eyes to a deviation to one side. All these things, what the observer looks, whoever is accompanying the patient, or whoever the stranger who is seeing that person, who is observing, that is called ictus.
Got it. And then the ictus is, then at the end of ictus, you have something called a post-ictal
state.
Yeah,
post-ictal confusion.
So till the ictus ends is the semiology of the
seizures.
And so, okay, you gave this example. So why should it have a special word? Is it the same for every seizure, or is the semiology varies from seizure to seizure?
Semiology varies from seizure to seizure. Brain is having different area and different functions.
Which is what you are showing.
Yeah. This is the brain, which is because if you are having 10 workers in your home, you are allotted each person another one work. Okay. Similarly, in brain also we are having so many areas allotted different works. Depending on which work it is observing, your clinical manifestation will depend.
So can you give, you told me about the hand going like that. What about any other example can you give?
Yeah, that thing is, we saw that train incident, that gyratory seizure. Again, it is coming from this frontal lobe only. Okay, I told you, this is the master. Okay, it is coming from ear. Example, this is something called temporal lobe, I told you, is concerned with memory. This temporal lobe is also concerned with comprehension of whatever was spoken language.
Correct.
Especially in dominant left side hemisphere. Okay. So example, I told you if it is coming from medial part of the temporal lobe, that is the innermost part of the temporal lobe, what will happen? I told you that aura sensations, they will get, that abnormal smell sensation, deja vu, Jamai-Suva phenomenon, all these things. What will happen after that? There will be staring look like this. Then they will have lips mapping movements like this. Sometimes there will be salivation from the mouth. Sometimes they will be having repetitive movements of the hands, picking movements like this. This is called automatism. Sometimes they may do posturing of hand like this. If it is coming from my right temporal lobe, I may do posturing of hand like this. Sometimes if
all this they'll be standing, they will not even fall down. The posture is not lost.
No, posture is not lost. In right temporal lobe places, sometimes they can have bimanual automatism also. Both hands they may be picking like this. And in sometimes non-dominant hemisphere, they will have ictal wandering. They will get up and start to walk.
Oh, I have heard that people have driven car and murdered people and come and forgotten.
So they just called ictal wandering. Sometimes they urinate also. Oh, I want to tell one incident.
Yes, please.
Yeah,
please.
Because when you don't recognize this as seizure, unnecessarily patient end up in problem.
Correct.
Okay.
Correct.
I had one patient is from North India. Okay. The history is like that. Sir, कुछ नहीं होता है sir उसको. ऐसे बैठे रहते हैं, सडनली खड़े हो जाते हैं, ऐसे 10-15 कदम डालते हैं सर, इधर उधर घूमते हैं, घूमने के बाद पैंट ओपन करके पेशाब करते हैं सर, उसके बाद उसको पता नहीं चलता है, थोड़ा देर के बाद उसको वॉश आ जाते हैं, उसके बाद वो वापस आ जाते हैं सर. So it has occurred in public places. So some people has that bad mannerism and some people have scolded him also. Finally, he was taken to some psychiatrist. He referred the patient to neurologist, and we know when we did MRI and EEG, he was having right mesial temporal sclerosis.
Oh.
Okay, these are the things. Friends, if people would have hit him also,
Howdo?
if it is, we
Yeah,
don't know.
anything could have happened.
Yeah, because so in society, because we are having so many civil rules are there, we are having so many rules. Okay, we have to obey them rules. So when you are not aware
If
of
this
that
had happened to a child in school, the
Yeah.
school would have sent them home, TC, misbehavior, whatever could have happened.
yeah,
alva?
when you tell school, I remember one more patient. He is from North Karnataka. His son of daily wage worker. They were in Bangalore only. He was studying in primary school. I think he is in third standard. When I was in Nimansa, I am doing fellowship. I saw that fellow. His history is simple. Okay, I will tell. This is called lateral temporal lobe. There is a temporal lobe, outer aspect.
Correct.
If any seizure come from this area, they will have aura of buzzing sensation in the ear, sudden sound in the ear.
In the year.
And some people can have giddiness also. So what he was having is, so he will be sitting in class like this, suddenly he will have buzzing sensation in the ear. So what he will do is he will hold like this. He will hold like this, and finally he will fall like this. Then he will do lip smacking movements like this. Like this he will do, and hypersalivation. So used to do weekly twice or thrice, 4 times like that
In the class.
in the class. So teacher thought that he was little bit backward in school. Okay, he was not that much academically good. Teacher thought that we are giving stress because of that he is doing. So homework maybe we are giving more that thing. But even when he was not stressed out also he was doing like that. Then teacher called mother and told show to ENT. He is having some sound in the ear. He tells some sound in the ear. Then they took to ENT. They told no, ear is normal. Ma, you take to psychiatrist. He may be having stress. Because of stress he may be doing like that. We call it as conversion disorder. Not conversion. Conversion
correct.
disorder. Okay, it is not malingering. Okay, without any stress is there, the people lose consciousness, like similar to that thing. They told like that. Then it was taken to psychiatrist. From psychiatry were referred to V people. Then I asked mystery. He told, sir, ನನಗೆ ಟೆನ್ಷನ್ ಇಲ್ಲ ಏನಿಲ್ಲ ಸರ್, ನಮ್ಮನೇಲಿ ಯಾರು ಬೈಯೋದು ಇಲ್ಲ ಓದಲಿಲ್ಲ ಅಂದರೆ ನನಗೆ ಆ ಟೈಮಲ್ಲಿ ಕಿವಿನಲ್ಲಿ ಮೋಟ್ರ್ ಹೊಡೆದಂಗೆ ಆಗ್ಬಿಡುತ್ತೆ ಸರ್, ಕಿವಿ ಹೊಡ್ಕೊಂಡು ಹೋಗ್ತಾ ಇದ್ದೇನೆ ಅನ್ಸಕ್ಕೆ ಶುರು ಆಗ್ಬಿಡುತ್ತೆ ನನಗೆ. ದೆನ್ ಆಮೇಲೆ ಏನಾಗುತ್ತೆ ಅಂತ ಏನಂಗೆ ಗೊತ್ತಿರಲ್ಲ ಸರ್. ಆಮೇಲೆ ಎದ್ಮೇಲೆ ಎಲ್ಲರೂ ಮುಖದ ಮೇಲೆ ನೀರು ಹೊಡೆದಿರ್ತಾರೆ, ಮೈ ಎಲ್ಲ ನೆಂದೋಗಿರುತ್ತೆ ನೀರು ಹಾಕ್ಬಿಟ್ಟು. ಲೈಕ್ ದಿಸ್ he was telling. Okay.
So can you say the same thing in English? So that,
Yeah. What he was telling is, you see sir, I am having buzzing sound. It is a motor sound. Okay, I am not able to tolerate that sound. That is so much high intensity sound. Afterwards, I will lose conscience. What happened to me, I will be not knowing. When I get up, I will be knowing my shirt and everything will be wet because normally they will pour, they will sprinkle the water over the face. Sir, it is happening so many months, sir. So everyone will think I am doing purposefully like that. He was not doing purposefully. And when they did his MRI brain, there was something called cortical dysplasia. Cortical dysplasia
Focal
means,
cortical dysplasia.
yeah, that means, see, our brain is most evolved, I told. It is having 6 layers. Example, bricks you will be keeping one over another. Sometimes it is crumpled. And
like you folded one on top of the other.
yeah. One above the other, the cells are folded. They will act as islands with independent kingdom. They can beat at any time they want. They are not under control of anyone. Okay.
Nane Raja anbiಟ್ಟು.
Nane Raja. Okay. So that is called focal cortical dysplasia. It can produce electrical activity on its own. Okay. So you see, why I am telling is class teachers are the one, because epilepsy is more common in 2 groups. One is childhood group and elderly groups. It is very common. So class teachers has to be educated because so many different
So
types of
valuable
seizures.
what you're saying.
Yeah,
Very
so many
valuable.
types of seizures is there. Many times they will think he is daydreaming, is not copying the notes properly.
You give an example on that. I'm
Yeah.
just going to ask you that question.
Yeah.
Let's,
Yeah, there is something called
because I also used to be scolded. Hey, don't daydream. Look at this and that.
yeah, that is correct. Okay, all daydreaming is not seizures.
All
Okay.
daydream. Oh, I got worried.
Okay, many people may not giving attention also if
Correct,
teacher
correct,
is very boring.
correct.
Okay, the thing is, we call it as childhood absence epilepsy.
Absence.
Yeah, like a generalized tonic-clonic seizures we are having. Similarly, we are in that classification. We are having something called generalized absence epilepsy. There will be no movement.
Like absent sir, present sir, absent
Yeah,
sir.
yeah. So previously they used to cut petit mal epilepsy.
Petit mal,
And nowadays
correct.
we won't use that thing. Use it as absence epilepsy. We are having different variant in that one. Childhood absence epilepsy, childhood myoclonic absence epilepsy, like that. Here what will happen? Just they will be sitting like this. But what happened? They will be not knowing. You notice anything?
No.
No, you thought that Shreedhar is concentrating somewhere. But if you ask me what you spoke at that time, I'm not able to remember. Okay, it can occur multiple times. Sometimes it can occur to 100 times.
And
Okay.
how long does this last?
It may last from 10 seconds to 1 minute.
See, 10,
Okay.
10 seconds. So it's very short. So
Yeah.
before people realize you're out of it.
Yeah. So I remember she was the one patient. I think is 10 or 12-year-old. All the whatever I'm telling you, these are real incidents I come across my practice. Okay. So 10-year-old kid, he was referred from ophthalmologist. Okay.
Eye doctor.
Eye doctor. The reason is not copying his notes properly.
Oh.
Okay, they have taken to ophthalmologist. He has examined them, everything.
Oh, because he can't see and that's the story.
Yeah, that is the story. The thing is we asked the mother, they have not noticed these things. Okay, so they told, says teacher is telling he is not concentrating much. Whenever dictating, in between he misses the sentences, sir. So when sir is dictating, teacher is dictating, if you lose 2 seconds, 3 seconds, that sentence will not be written. You are not maintaining notes properly also. Okay. So then one simple method is there to induce the seizures in the absence epilepsy. What we'll do is we'll take piece of paper. Okay. We'll take piece of paper like this. Then we'll ask them to blow. You notice it? Okay. Whenever you do hyperventilate.
So you're taking deep breath.
Yeah. Whenever you hyperventilate, there will be carbon dioxide washout will be there. Something we call respiratory alkalosis. It felicitates the electrical activity, abnormal electrical activity in brain. They will have, this is one of the provocative tests we do to confirm. He was 10 seconds, he was not able to recognize. What happened, he was not able to know. Okay, then I asked family members, he will do like this you saw now. Is 10 seconds he was not responding. This kind of thing is there. When you are sitting in home, suddenly you will be seeing somewhere, if you call he won't respond. Sir, multiple times he does like that. Then I told them, this Sunday you sit with him from morning to evening. You count how many episodes will occur. Next Monday they came and told around 25 to 30 episodes per day there it is occurring. So these kind of seizures, it can be well controlled with medication.
Imagine the family didn't even know. It's not, see, we have a dialogue in medicine, what the brain does not know, the eyes can't see.
Yeah, that's the same thing.
Classical example of that.
Yeah, same thing.
Can't blame anybody.
Yeah. So then now they're coming to follow up. Then now they are telling he has improved in his academics. Because he was not able to listen. When he is not able to listen, he is not able to register.
And the short circuit in the brain is having its own consequence.
Okay. Whenever you are having electric shock, before registration only, example, if you are writing on blackboard, before taking notes only, if you rub it, then you cannot have. It's like this. Okay. So he was not able to register the whatever things is happening. That's why he was told as backward in school. Okay. With antibiotic medication completely disappeared, his academics also improved. Okay. These are the things. Okay. So these kind of seizures are commonly missed. Okay.
So these are two common things. So any other area of you said about temporal lobe, you spoke about frontal lobe, you spoke about the motor cortex. Which other area of the brain is epileptogenic or you can get?
The thing called, this is the area. The posterior part is there. This is called occipital area.
Correct.
It is concerned with vision. If you are having camera, okay, olden Jamana ka camera. If you are having camera, you are having lens and reel.
Correct.
Okay. High work as a lens. It focuses on the image and captures the image with better illumination. The processing of image will occur in that reel.
Correct.
You used to see like this,
correct,
that reel.
Correct.
Okay. That reel function is done by this occipital lobe. It stores the visual memory, okay, and stores that thing here. Okay, it interprets there. Okay, if anybody is having seizure from this area, they can now, we call elementary visual hallucinations, because occipital lobe is not controlling the consciousness. Usually consciousness will not be lost. Okay, so what they will have is they may be seeing some straight lines in visual field, some zigzag lines they can see, colored halos they can see. Okay, sometimes well-formed images they can see. They can see cartoons, they can see human beings in their visual field.
Cartoons also. Right?
Cartoon also they can see. The thing is, but when I am telling like this, but there is one more aura is called migraine aura.
Okay.
There also they will be having zigzag lines.
Migraine means that headache.
Yeah, the headache aura, the off headache aura.
Ah.
Okay, many people will have blurring of vision and zigzag lines, stars. In that also they will get visual aura.
So now you are saying that we should remember both these when
Yeah. How we will differentiate?
how to
is,
differentiate?
The thing is, epileptic aura is very few seconds to minute. It may not last for more than 1 to 2 minutes. If it is lasting for 1 to 2 minutes, what will happen? The thing is, this abnormal electrical activity I told. Whenever it is electrical activity is generated, it will move forward like this.
It starts spreading.
It is spreading. Example, if you throw a stone in pond, ripples will
Correct,
come. If
correct.
it is strong enough, the ripples will reach the shore. If it is that much strong, if it is producing so much symptoms, it may reach the motor cortex and end up in secondary generalized seizures. Many people will tell, sir, I will have blurring of vision, afterwards I will have big seizures. It is arranging in this area, then it is moving forward. Okay, the duration of epileptic aura in case of hospital lobe epilepsy is only for seconds to minute. In case of migraine, it may last for 15 minutes, 13 minutes also, 30 minutes also.
The duration makes
Duration is
one
important.
of the.
And one thing what we have observed in our clinical practice is, migraine aura will most of the patients is black and white aura. Okay, but in visual aura of
color picture, the black and white picture.
black and white picture. Okay, visual
Interesting.
aura of epilepsy
Amazing.
patient, many times it may be colorful also. They can get black and white also, but it can be colorful also. Colorful auras is very rare in migraine's aura. Okay.
Interesting. Very interesting.
Yeah.
So, any other aura? Like we have spoken about smell, we have spoken about sound, we have spoken visual, and anything else, taste, anything else. You had day before today, we had a patient who was having this salivation and all of that. Remember, we had the brain tumor that we diagnosed recently.
Yeah.
Remember that he came with a very funny symptom, very high performing individual, very well-to-do people.
Okay.
What
the
was
thing
his
is,
story?
His story was, okay, he is having symptoms since only 10 days. Okay. His symptoms is, suddenly you will feel some hypersalivation from mouth. The drooling of saliva will be there.
Outside.
Outside will be. And suddenly will feel difficulty in speech. Okay. And he is partially aware of that event. Okay. It is not fully aware. He is partially aware of event. It is occurring in periodic interval. 1 minute, 2 minutes it is occurring. Afterwards he is becoming normal. Okay. It is the seizure which is coming from the left temporal area. We saw that thing. He was having space occupying lesion in his left temporal lobe.
The brain tumor.
With edema. Okay. The tumor can manifest like that also. Okay.
Amazing.
Yeah.
So now you have spoken to us about some types of epilepsy.
One more thing I forgot.
Sure.
See, if you are pinching here, okay, if you pinch me here, I will tell Dr. Sharan is pinching on my right hand. Okay. Whether it's a pinprick sensation or touch sensation or electric shock sensation also I can tell.
Correct.
Why you know? Because of my parietal lobe. Okay. If any seizure coming from this area, okay, they will have some abnormal sensation in opposite part. Because I have told previously, our brain is always opposite control. Okay, if left parietal area is affected, I may have some electric shock like sensation in the right half of the body.
Or the jum sensation also is possible?
All jum sensation is not seizures. Okay, it is very non-specific symptoms. Okay, we should not overdiagnose also. All jums are not seizures. So the important thing is seizures, this kind of seizures. Okay, so when you are diagnosing, you should take detailed history. Okay.
Story. Every patient tells us a story.
Seizure is the one thing in medicine. Okay. It depends, 99% it depends on history only. Whatever our EEG, MRI, brain, all these things is a collaborative evidence. Okay. Here completely you rely upon history. Okay. Sometimes MRI and EEG, everything can be normal. Okay. Only history is the guiding thing. A gold standard test for diagnosing epilepsy is history.
Amazing.
Gold standard history.
He is talking in 2025 with all the technology available in the best of countries. He's saying gold standard is still patient telling a story, the doctor listening to the story, getting the right story. So eventually we have to spend time with the patient, and you can't shorten the time and say get this test done, get that test done, none done the test, because you don't know what you're searching for, you don't know what you will find.
For that matter, neurology is completely depends on history. Most of the time we will be end up in normal investigations. Okay. So that's why I tell my colleagues, whenever artificial intelligence comes,
I was just going to say
least affected is neurology branch.
I was just going to say that
because
AI will not affect us for a long time
yeah,
to come.
Because clinical skill will play pivotal role to become
Fantastic.
neurologist or neurosurgeon. Okay.
So if you want to beat the AI, get AI proofed, become a neurologist. That's the
correct.
model, or a neurosurgeon.
No AI can interpret a DTR.
Correct,
properly. It is
correct.
subjective.
Correct.
Okay, so no DTR can interpret touch sensation, grading the sensation. No AI can interpret the emotion of the patient when they are speaking.
Absolutely.
Okay.
So I'm going to ask you a very interesting question now. One of the commonest causes of seizure we see is something called NCC, not National Cadet Corps. Can you tell our viewers what NCC is?
NCC stands for neurocysticercosis. You would have heard about pork tapeworm.
Tapeworm. Yes, yes.
Yeah,
In school, primary school, we will
yeah,
have
yeah,
what
yeah,
that
yeah.
cycle,
Yeah,
whatever
that
it is,
is the
cycle
cycle
tapeworm.
used to
Like that.
tapeworm cycle will be there
Huh.
now. So nowadays it is coming down because of the improved hygienic habits and food safety standards. This has come down. So especially the meat which is containing this larvae of
Pork,
the
especially pork.
especially pork meat, okay, or that is whatever the excretion is there, that animal excretion is there, that is that impurity, whatever the eggs are there,
Contamination.
contamination of fruits or vegetables, all these things. When you swallow, okay, example, if you take meat, if it is not cooked properly, the larvae of that tapeworm may be
The
there.
larva.
That larva, small larvae, when it goes to intestine, it will bypasses and enters the blood. Then it may go settle anywhere. Okay, it may settle in brain, it may settle in muscle, it may settle anywhere.
In the eye
Okay.
also. It
In
can
eye
settle.
also,
Yes.
in
Yes.
eye also it can settle. But when once larvae goes there, it is having some period of life. Afterwards, it will die. Whenever it dies, death occurs, it will release so much chemicals. It will cause inflammatory reaction. In depending in brain also, it will cause inflammatory reaction. Inflammatory reaction means it is just swelling, okay, irritation inside the brain. So any irritation will cause seizures.
I
Okay.
want to tell you two stories here of NCC, neurocysticercosis.
Not
Tape-
essential. From vegetarians also get many times.
Yeah, I was
Because,
just going to say
yeah,
that.
yeah, because the eggs will be there, contaminated eggs will be there once they enter the
Soppo.
stomach.
If you eat all your soppo greens grown in sewage water,
Yeah,
she's selling cheap. So cheap cost kammi anta if you go buy there, soppo grown in sewage water can cause
yeah,
tapeworm.
the eggs may be there, they will hatch and larvae will come,
So
larvae will
guys,
enter the blood circulation.
the risk
Okay.
is too much.
Yeah, yeah,
I remember the one lady had 300 tapeworm larvae. 300, you put on the scan like starry sky.
yeah, starry sky
Starry
appearance.
sky appearance. But one
Okay.
story, not epilepsy, but I have to tell this story. This guy is a Kurgi guy. Kurgis eat
Yeah, yeah,
pandi
they're
curry.
fond of
Huh.
this thing.
This guy is living in Papua New Guinea. Papua New Guinea is a small island off Australian coast. Okay, and then he had a hockey injury to his right eye when he was a child and lost vision in this eye. He had only vision in one eye. And Papua New Guinea's medical care is very bad. Even for dental treatment, they have to come to Chennai. So this fellow, there was some vision problem in the normal eye. So he said, I have to come to Bangalore, India, and let me come and get tested. He has came to Bangalore, went to an ophthalmologist. Somebody has tested him and said, you're okay. Psychological, go away. So he went, he's sitting with a friend like this, opposite, and they're having a drink in the evening. So a friend was asking him, why you came to India? He said, I had some vision problem. So I went to ophthalmologist. He said, everything is okay. That friend, Chuma picked up his finger. Look at my finger. He started doing like this. Suddenly he saw in one portion he couldn't see his finger. And then he did again. Then he realized one patch like this he could not see. Then he realized, oh, something is going on. Then he came to us. We did a scan. Just above the eye, where the eye two nerves meet, what we call the optic chiasm, some tumor-like thing was there. So we posted him for operation. Okay. We opened the skull and cellular, supracellular mass and all. We are looking at it, no tumor. Literally, there's nothing there. My chief was telling, where is this? What's going on? Then suddenly we focused on the chiasm, where the two nerves meet. It looked swollen. Okay. Then we realized something was inside that optic chiasm. So he put a small nick on that. You know what came out? Tapeworm larva. Oh, yo. I got the best poster prize for that. And under microscope, it just came out like that. It was unbelievable. Where it has gone and sat. And post-op, his vision is fine. So the tapeworm larva, you cannot even imagine.
It can go anywhere. It can go to eyes, tongue,
Yes.
muscles.
So why we are saying eye is important, guys, is if suddenly you have a tapeworm larva in the brain, they start you on tapeworm treatment. before you take the tapeworm treatment, you have to get the eye tested because you can go
to
blind
confirm.
otherwise.
You have to confirm the larvae is not in the eye. Otherwise, the death of larvae will cause extensive inflammation and it will cause acute blindness.
Yeah, so remember that. So just don't say, you don't self-medicate. Oh, I know what to do. Shreedhar said that, Sir said in the video, I can self-medicate. All those dangerous things, please understand. None of these are self-medication business. You have to go and show up with your doctor and he will tell you what is to be done.
Podcast is always to increase the awareness.
Correct.
Okay. It is not it is not, we are not guiding in
Correct.
self-medication.
Absolutely.
You have to meet the doctor and take proper advice them. You have to tell your history. He has to examine you. Then only.
See, because he said, no, he went to this doctor, then he went to this doctor, then he went to this doctor, then he came to neurologist. So we are trying to shorten this whole, conversation or this visit so that you go to the right person, right time, and not land up with the what happened to that policeman. That could have been saved, that life could have been saved, tragically. We don't know how many times this happened before that. So neurocystic psychosis, I think, is something worth everybody knowing.
Yeah.
One of the commonest
especially
things
in developing countries, it is very common.
Absolutely. So now coming back to semiology. Now you have said that you have this semiology and you have taken this history. You said 95% is it history. Now casually, a couple of places you mentioned about you do a scan, you see focal, cortical dysplasia. We spoke about the patient with the brain tumor, neurocystic. So what are all the tests that we do, before we come up to other, types of seizures that we see, triggers? What are the normal tests you do to diagnose whether a patient has epilepsy or not and what to do next?
The most heaviest organ in our body by ego is brain. Okay.
ಅದಕ್ಕೆ ಹೆಡ್ ವೇಟ್ ಜಾಸ್ತಿ ಅಲ್ವಾ
head weight ಜಾಸ್ತಿ that ego is the one which makes it more weight. I told you the gold standard test is history.
Correct.
Okay, then coming to depending on the patient age, okay, family history and his comorbidity is very important. Example, 55-year-old male present with first episode of seizures. He is having hypertension and diabetes. He is on some medication which decrease the sodium. Okay, first thing you have to check sodium. Whether hyponatremia, we call something called symptomatic seizure. They are provoked seizures.
Low sodium provoked seizures.
Low sodium can cause seizures. Even high sodium can also cause seizures. Low calcium can cause seizure. Hypercalcemia can cause seizures. Hypomagnesemia can cause seizure. These are the things we are having provoked seizures. These are
all these sodium, calcium, magnesium. I thought it was only in periodic table. You are telling that you have to check that periodically. Periodic testing has to happen for the
example. Patient is undergoing dialysis. If he is having seizure, it may be due to uremia, that accumulation of bad products in the blood.
So chemistry problems in the blood can trigger seizure because brain is also chemistry.
If a chronic alcoholic, he is having liver injury, that itself can cause. He is having chronic liver disease, that itself can cause seizures. Because liver is one of the organ, it will purify the body. Okay, that can also cause seizures. Or if he is alcohol, if he is eye opener, in morning, once he get up at 7:30, will start to drink. When he ends at 10:30, when he is going to sleep. In that kind of people, suddenly stops alcohol because body has addicted for that thing. We call rum fits, alcohol withdrawal seizures. So history is very important. Especially in this kind of history where the antecedent reason is there. Example, hyponatremia is there, hypercalcemia is there, or the alcohol withdrawal is there. Here we don't need any long-term seizure medication. That is very important.
That's why he is saying it.
Yeah. Because otherwise what we will do is we will give seizure medication. We don't have any particular duration, but most of the time we practice 2 years to 3 years we give them medications. But here there is no need to give long-term anti-epileptic medication. Sometimes they may not require anti-epileptic medications also. That's why it is very important to know whether it is I told you initially, it is a provoked seizure, unprovoked seizure. Otherwise, if you label provoked seizure as unprovoked seizure, unnecessarily may be ending up in taking medication for 2 years.
And every medicine has its own problems, whether you like it or not.
So I will tell always my patients, there is nothing in this world without any side effect. Even if you think water is good for health, if you think like that, if you go on drinking water, then you will end up in hyponatremia. Water retention. Okay, we call pathological polydipsia. Okay, so or psychogenic polydipsia. So nothing. Atiyadre amrutanu visha. Okay, like this. So this is.
But I want to say something on side effect now, because you brought up the issue of side effect. See, I've seen. I'm quite sure you also face it in your practice regularly. The moment you write any prescription, sir, what are the side effects? The common thing many people ask us, and they look very intelligent when they ask us. So I tell them from a long time, no, Appa, you have come to me here because of side effect of whatever you have done. When you eat pani puri on the roadside, you don't look for side effect. When you drink that aerated drinks, you're not looking for side effect. You know how much lead is there in so many of the things. We don't know. Only when you take our medicine, you suddenly become intelligent, know what's happening. Please pay attention everywhere. Everywhere what you're doing or not doing has its own challenge and side effect, because of which you can run into trouble. Sorry, you can continue.
Yeah. Then comes, these are blood investigation I was telling.
Correct.
Okay. Then comes something called MRI brain and EEG or CT scan, like that. Okay. Why are doing imaging? Imaging means either structure of the brain we are seeing either through MRI brain or CT scan. So mainly we want to rule out any structural cause. Structural cause means any tumor is there, infection is there. You told neurocystic sarcosis. Other than neurocystic sarcosis, one of the causes is tuberculosis in India. Okay, any lesion in brain can be tuberculoma. That's what we were taught. Okay, so any tuberculosis is there, any infections is there, or any scarring up inside the brain. Example, patient would have had normal delivery in home. The baby would have cried late.
Home delivery.
Home delivery, and now he may be having 25 years age. At even that hypoxic seizure, the hypoxic induced gliosis scarring is there. Correct. It may manifest at 25 years of age also. So when
some damage to the brain that has happened during childbirth or immediately after, which has not been picked up.
No, it would have not manifested the clinical symptoms. Okay, first time it can present as a seizure at 25 year age. So we have to see any scarring is there inside the brain. Okay, so to rule out mainly structural lesion, we do MRI brain. In most of the patients, MRI brain will be normal. Okay, in some patients we do CT scan depending on the because it depends on the age of the patient and suspicion also. Then comes EEG.
So before you go to EEG, do we do only plain scan? Do we do a contrast scan? There's something called special MRI epilepsy protocol.
Yeah.
So can you tell a little bit on details on those?
See, in MRI there's so many sequences are there. Okay, in photography also you are having so many things. Now when you go for settings, in the reception they will tell so many photography is there. Okay, similar to that thing in MRI, so many sequence we are having, T1 sequence, T2 sequence, player sequence, gradient sequence, so many sequences are there. So whenever we deal MRI brain epilepsy protocol, so specifically in addition to these sequences, we are specifically looking for the hippocampus also. That is one of the common site for the seizures.
What is hippocampus?
Hippocampus.
Why is it called hippocampus?
Hippocampus is a medial part of temporal lobe. I told you, na?
The inside part of the temporal lobe.
It's a small
that
fellow.
Small fellow, but a smart fellow.
Smart fellow. Okay, because it looks like a seahorse. Okay.
Seahorse.
Yeah, it looks like a seahorse.
Correct.
That's why it is called hippocampus.
Hippocampus. Seahorse.
Seahorse. Okay. Specifically, we look for that area, temporal area.
So why are you looking for that area?
Because that is one of the common cause for seizure.
Common spots.
Common spots for seizure. If patient is having long-standing seizure, okay, then we call something called scarring of that hippocampus. We call mesial temporal sclerosis. Okay, so any MTS is there to look for that thing. Or the size maybe when compared to one side, size may come down, like the shrinkage of that part may be there. To look for that thing, we ask that epilepsy protocol, specifically we look for that thing. In epilepsy protocol, there are some sequences. I told you focal cortical dysplasia. That means the layer-wise arrangement of I told you 6 layer.
Like this.
Yeah. The layer-wise arrangement of the 6 layer, like a bricks, it is arranged. Okay. Sometimes it is crumpled. It is not arranged properly. We call it focal cortical dysplasia. In particular sequence only, we are able to appreciate that.
It's like folding a shirt and keeping it, crumpling it like this and putting it in the corner.
So you want to pick up a focal cortical dysplasia. Also, certain sequences are needed. Example, you are having neurocystic sarcosis, tuberculoma. Then we have to give contrast injection. Okay, so how it when we give dye, how it is enhances. Okay, and even if a tumor is there, how it enhances depends based on
lights up.
Lights up. So depending on that, we can grade the tumors also.
So what Dr. Shreedhar is trying to say is, he is saying hippocampus, scar here, there, focal cortical dysplasia. The seizure starts from that spot. And that is called the focus.
Yes.
Yeah. So we call that is the starting fellow. From
Correct.
there he starts going in whichever direction that it can go. It's called the spread, like how we showed. The spread is there. So that's what the MRI is done. Like how we have the MRI stroke protocol to look for stroke, you have an MRI epilepsy protocol. So if the routine epilepsy, routine MRI is normal or what happens many times is they go to a general doctor, he gets off an MRI done, they get a routine MRI and come to us. If our clinical suspicion is high, then you still have to go and probably do an epilepsy protocol to make sure that we have not missed anything. Correct, Allah? Do you agree with that?
Correct. Even when we are writing also, we specifically write, example, patient is having focal seizure with loss of awareness, more likely right temporal onset.
So you are actually telling them to look for this place.
I told you, history is giving from which area the problem is coming. Okay. So history is telling you, I am in right temporal lobe. You concentrate on me.
Look for me here.
I am here.
Correct.
Okay, we'll write. So focal seizure, loss of awareness is right temporal onset.
So you're not carpet bombing.
Yeah, radialist has to be informed. Because without informing, it is very difficult to identify. Okay, he should have some suspicion. Then only he can look at that area properly.
Clinical suspicion.
Clinical suspicion. That's why they will write. Radiologist will write clinically correlate. So before they writing clinically correlate, we have to tell our clinical findings to them.
Correct.
So that the clinical correlate, the word will not come there.
Absolutely.
Okay.
Well said. Well said. Before we go into EEG, so let's take a small deviation. You do this Kagga.
Yeah.
So can you tell our audience why do you do this and what is Kagga and what is this? Why do you like it?
Yeah. The thing is,
you can say both in Kannada and English so that you know you can. Kannada mother first, then you can translate to English.
Yeah. I love Kannada subject very much. Okay.
Why? Because of where you came from. And where were you doing your education from? Initial education.
Yeah, my village name is Vanke Marade Kaval. It is a very small village.
Illi, where does it come?
It comes from it comes in Chitradurga district, Odalkere Taluk. And we are having we were studying till 4th standard. We were in our primary school was there. After that, we have to go to 5th standard to 7th standard. We have to go to another village. It is 3 kilometers from that place. From 8th to 12th standard, another village 5 kilometers from our
You're
place.
walking every day?
Yeah, every day we were walking.
My goodness.
I was very healthy at that time. Because daily I used to walk for 6 to 12 kilometers.
Amazing.
Okay. So, they are very beautiful moments. Okay. So, it is a village.
And Kannada medium, huh?
It is Kannada medium. Till 8th standard, I was in Kannada medium. Afterwards, we joined 9th standard, 8th, 9th and 10th standard was English medium. But in rural areas, even English medium is like a English medium. Kannada medium only. They will translate everything.
Correct.
Okay. So
bus bus broke down.
My English is also like that only. Because literal translation of Kannada.
Correct. We think in Kannada, translate to English and buy with the English.
Okay. So whatever we speak, that English is not extraordinary English. Because I always tell my students I am speaking in English. So I found up Kannada. Always from 1st standard, 12th standard, my Kannada was always highest in my school.
Oh, you were the superstar.
Even in my 10th standard, I think for 125 marks, my Kannada marks were I think 122. I think. Yeah.
Kannada kashta kano adu.
So I was loving Kannada. So I read Kagga. Whatever the limited time I get, I may not able to read too many things.
There's a lot of extracurricular activities.
Yeah.
You don't listen to me.
There's
a lot of things.
I read Mankutimana Kagga and I read Vachana Sahitya. And other than that thing, I will read Sarvagna Vachanas.
So tell us some.
One more thing I will read is Ranana Gadayuddha. These are the 4 topics I read on and off. Okay. So, Sarvagna Vachana I will tell.
Anything.
About knowledge.
More than one.
ಸರ್ವಜ್ಞನೇನ್ ಗರ್ವದಿಂದಾದವನೇ ಸರ್ವಜ್ಞನೇನ್ ಗರ್ವದಿಂದಾದವನೇ ಸರ್ವರಲು ಒಂದೊಂದು ನುಡಿ ಕಲಿತು ವಿದ್ಯೆಯ ಪರ್ವತವೇ ಆದ ಸರ್ವಜ್ಞ. You become intelligent, not by arrogance. You have to beg knowledge from everyone. You have to collect it like this. And that knowledge will become ill in you. Okay. Vidya Parvata. By gaining knowledge from everyone, you will become intelligent. Okay. Not by arrogance. That is the essence of that Sarvagna Vachana. So, that's how. Okay. So, and one Kagga is there. Okay. So, example, we are living in this society. Each person is having a role. I am a doctor. I am having my role. Okay. Is a cameraman, he is having a role. Sweeper is having his role. Is nobody is superior, nobody is inferior. I always tell, I tell my children also, whoever sweeper is there in front of our house, who is doing in morning, he is equivalent to me. Okay. He may be not having that much money what we are having, that much publicity may be not having. As a human being, is equal. He is also serving the society. I am also serving the society. Cameraman is also serving the society. He is recording the people. Okay. So each person has a role. There is one Kagga is comes. ಬಿಳಿಲಲ್ಲ ಬೇರಲ್ಲ ಮುಂಡ ಕಾಂಡಗಳಲ್ಲ ಮಲರಲ್ಲ ತಳಿರಲ್ಲ ಹಣ್ಣು ಕಾಯಲ್ಲ ಬಿಳಿಲಲ್ಲ ಬೇರಲ್ಲ ಮುಂಡ ಕಾಂಡಗಳಲ್ಲ ಮಲರಲ್ಲ ತಳಿರಲ್ಲ ಹಣ್ಣು ಕಾಯಲ್ಲ ಎಲೈ ವಿಶ್ವ ವೃಕ್ಷದೊಳ್ ಎಲೆಯೊಳೊಂದು ನೀ ವಿಶ್ವ ವೃಕ್ಷದೊಳ್ ಎಲೆಯೊಂದು ನೀ ಅದ ತಿಳಿದು ನೆರವಾಗು ಮಂಕುತಿಮ್ಮ. ದಟ್ ಮೀನ್ಸ್ ವಿಶ್ವ ವೃಕ್ಷ. Example, this is a big banyan tree. This word is a big banyan tree. Okay. So, which part of the tree we are? Okay, I am not root, I am not stem, I am not branch, I am not flower. Okay, I am not even ripened fruit also. Then who am? I am just a leaf. Leaf is always replaceable. What is the function of leaf? It has to do photosynthesis and it will make the tree strong. The tree was, when it was small, it was very small plant. Na? Because of these multiple millions of leaves only, it became this much big. Root has become strong. But leaf should not have ego. Because of me only, this fellow has grown like this. But because tree will tell, you are always replaceable, man. I will replace with another leaf. So we have to know photosynthesis is that what its work. Like that, we have our own work. We have to do that work. Okay, and whenever time comes, we have to go. Okay.
Correct. That's the only thing guaranteed in life.
Yeah. So for that thing also,
ನಿಮ್ಮ ಮಕ್ಕಳಿಗೆ ಹೇಳ್ಕೊಟ್ಟಿದ್ಯಾ ಅದೆಲ್ಲ?
I will always tell my children.
But your children, you did something with your children in that ಇದಲ್ವಾ recent ದಸರಾ ಟೈಮ್ ಅಲ್ಲ?
ಗಣೇಶ ಫೆಸ್ಟಿವಲ್.
ಗಣೇಶ ಫೆಸ್ಟಿವಲ್. ಅದೇನದು? What is that going on ನಿಮ್ಮೂರಲ್ಲಿ?
So ರನ್ನನ ಗದಾ ಯುದ್ಧ I told. Okay, Ranan Gada Yuddha I like because it Ranan Gada Yuddha.
What is that? Gada Yuddha ಏನದು?
That was we call Kavi Chakravarti Ranna. Okay, he was the 9th century poet. Okay, he has written regarding the 18th day what will happen on Mahabharata war. That he has written in
the last day.
Last day. Okay, it is very dramatic story. Okay, it is full of emotions. Okay,
and you can show us some emotions.
Yeah,
we'll get the video also and play it parallelly.
See, ದ್ರೌಪದಿ ಇನ್ ಮಹಾಭಾರತ ಯಾರಿಗಾರು ತುಂಬ ಅನ್ಯಾಯ ಆಗಿದೆ ಅಂದರೆ ದ್ರೌಪದಿಗೆ ಆಗಿರೋದು ಅನ್ಯಾಯ. ಹೆಣ್ಮಗಳು ತುಂಬ ಸಫರ್ ಮಾಡಿಲ್ಲ ಅವಳು. ಓಕೆ, ದ ಮ್ಯಾಕ್ಸಿಮಮ್ ಇಂಜಸ್ಟಿಸ್ ಡನ್ ಟು ದ್ರೌಪದಿ ಇನ್ ಮಹಾಭಾರತ. ಓಕೆ, ಸೊ ದ ಥಿಂಗ್ ಈಸ್ Draupadi's sake only they have killed all the people.
Correct.
Okay, in whatever that Jujata happened, at that time Bhima will tell, I will kill all the Kauravas including Duryodhana. I will eat his thigh. Okay, told. So 17 days war is over. 17 days war is over. Only Duryodhana is left. Then Draupadi will come to Bhima and encourage him to go and war with Duryodhana. Okay, so a wise wife, how she will convince the husband. Okay.
And the ಹೆಂಡತಿ ಇವಳಿಗೆ ಹೇಗೆ ಕನ್ವಿನ್ಸ್ ಮಾಡೋದತ್ತ?
Convince. I always tell there are 5 gurus in life. First guru is school teacher. Second guru is your father. Third guru is mother. Fourth guru is your wife or husband. They will guide you properly.
Spouse,
Yeah. And for our practice, the 5th guru is patient. They are the one they are teaching we people. They are making we people to read and more and making we people knowledgeable. Draupadi will tell, okay, ಒಡಲ್ ಒಡುಮೆಯೆಂಬಿವೆರಡುಂ ಕೆಡುತ್ತಿರುಪ್ಪಂ, ಒಡಲ್ ಒಡುಮೆಯೆಂಬಿವೆರಡುಂ ಕೆಡುತ್ತಿರುಪ್ಪಂ, ಕೆಡದ ಕಸವರಂ ಜಸಂ, ಕೆಡದ ಕಸವರಂ ಜಸಂ, ಅದರಿಂ ಕೆಡುವ ಒಡಲ್ ಒಡುಮೆಯಂ, ಕೆಡದ ಒಡುಮೆಗೆ ಮಾರಿಗುಡುವುದು ಇರುವ ಬೆಡಂಗ. That means ಒಡಲ್ ಒಡುಮೆ, this body and whatever the property you have accumulated, whether it is a movable property or immovable property, one day they will perish. Okay, ಒಡಲ್ ಒಡಮೆ ಎಂಬಿವೆಂ ಕೆಡತಿರ್ಪಂ,
ಆಸ್ತಿ ಆಸ್ತಿಯನ್ನು ಗಲಾಟೆ ಮಾಡ್ತಾರೆ.
ಕೆಡದ ಕಸವರಂ, what is the thing which is not perishing? Even I am after I vacated this planet, which is not going to perish. That is the good deeds, whatever you have done, it is the one which is going to stay for long time. So you have to invest your body and your energy and your whatever the movable immovable property to uplift the to make the fame, okay, and to make the work which can be remembered by generations. Like that she tells, go and kill the Duryodhana, okay, you will be remembered in history. Okay, like that. So ideally she tells like that. So like this I am.
Fantastic. So we are going to get back to our job.
Yeah.
You said there was a kagga about genetic connection with epilepsy.
Yeah, it's a genetic collection. The thing is, first thing I want to tell is all the epilepsies are not genetically related.
Correct.
Okay, so very few percent of epilepsy, because one more myth about epilepsy is all the epilepsy is genetically linked.
The familiar.
Familial. Yeah. So
ಅಪ್ಪಂಗಿತೆ ನನಗೆ ಬರುತ್ತೆ, ನನಗಿದ್ರೆ ಮಗನಿಗೆ ಬರುತ್ತೆ.
People will take hereditary. In our clinical practice, we'll see more than 90% will not have any seizure history in family. Okay. So it was written in 1943. I told DVJ written Kagga.
DVJ
before this helical pattern, all these things, DNA, all these comes. It is the observation of our ancestors.
The Watson Crick model.
Yeah. It is the observation of our ancestors. Okay.
ಅದು ನೋಡಿ DVJ ಬರ್ತಿದ್ದು.
No, the thing is, you see, normally the thing is human behavior we see na, you tell na, you behave like your grandfather,
Correct,
you behave like a grandmother. Okay, so it is observation by DVG. Okay, or many people would have written like this. Okay, this is before DNA concept, all these things. Okay,
DVG and the explanation ಹೇಳ್ಬಿಡವ expansion.
DV Gundappa. Okay, so he is one of the renowned writer. Okay, in our Kannada. Okay, the thing is Manku Timman Kagga we call Kannada Bhagavad Gita. If anybody has not read real Bhagavad Gita, no problem. You read this Kagga as a Bhagavad Gita. Is easily understandable thing. It comes in English also, Kannada also it comes. Okay, so it tells ನಿನ್ನಜ್ಜ ಮುತ್ತಜ್ಜ ಮೂಲಜ್ಜರೆಲ್ಲರೂ ನಿನ್ನೊಳವತರಿಸಿ, ನಿನ್ನಜ್ಜ ಮುತ್ತಜ್ಜ ಮೂಲಜ್ಜರೆಲ್ಲರೂ ನಿನ್ನೊಳವತರಿಸಿ ಮುಂದಿನ್ನು ಜನಿಸಲಿಹ ನಿನ್ನ ಮಗ ಮರಿಮಮ್ಮರುಳ್ ಜೀವಿಪರ್ ಅನ್ವಯ ಚಿರಂಜೀವಿ ಮಂಕುತಿಮ್ಮ. That means, see what I am. Who is Shreedhar? Shreedhar is having genetics. Na? It's the genetic component what I am having. It is my mother and father. Where they are getting that from their grandmother and grandfather. Okay, so I am nothing but genetic makeup of our ancestors.
Correct.
Okay, so we tell na, ನಿನ್ನ ಮೂಗು ನೋಡು ನಿಮ್ಮ ಸೇಮ್ ನಿಮ್ಮ ಅಜ್ಜನ ಥರ ಇದೆ. Okay, whether you remember your father or not, whether you remember your grandfather or not, but you are inheriting your phenotype and genotype in you. Okay, you are having behavior in you, because genetics is the one which defines physical thing and mental thing. Okay, so ninnajja muttajja moolajja, whether you remember or not your ancestors, they are living in you. And even in my son they are living, my grandson is living, even I am vacating at this planet, afterwards also they are living. I am living in my generation. Dr. Shreedhara, even though he is not there in physically, he may be living in his generations. Okay, that's what he told. Yeah. So many kaggas are there like this.
ಎಷ್ಟು how it gets scientifically connected, philosophically connected. ಅಮೇಝಿಂಗ್ ಎಲ್ಲ ಅದೆಲ್ಲ ನಾವು ಕಲಿಬೇಕು. ನಮ್ದು ಸನಾತನ ಧರ್ಮಲ್ಲಿ ಎಷ್ಟಿದೆ ಅಲ್ವಾ, ಇಟ್ ಜಸ್ಟ್ ಸಚ್ ಅ ಜಾಯ್.
So many people will scold Bangalore traffic. Okay, what I do is in Bangalore traffic I will listen to this thing, which has made me more intelligent in Kannada. Okay,
so Bangalore traffic problem solving ಹೇಳ್ಕೊಟ್ಟಿದ್ದಾರೆ ನೋಡ್ರಪ್ಪ.
No. Bangalore traffic, you by using your Bangalore traffic you can gain your knowledge. Okay, example, from my home to Jain Hospital it will take 1 hour. 1 hour I will listen to Kagga, I will listen to Rananaya Gadayodha, I listen to some YouTube audios. Okay, it is anyhow I am utilizing that.
Correct,
thing.
utilize
Okay,
it.
that is something called procedural memory. So you will be driving, but you will be listening. Okay,
auto mode, your driving is auto mode.
Yeah.
Perfect.
Yeah.
Very nice. You told me a story of somebody who had mathematics induced epilepsy or something like that. What is that?
That is called noogenic epilepsy.
Noogenic.
Noogenis. It is very, very rare.
Very rare.
Okay, in last my more than 10 years experience, only one patient I have seen OV that is in residency. It is very rare. It
Doesn't
is not
matter.
that
Just
much
to
common.
know what is
Okay.
possible. Huh?
Okay, the thing is he was a scientist. Okay, he was doing complex mathematical calculation and he was giving talks. Whenever you go and explain complex mathematical calculation, he will struck in between. He is not able to speak. 10 to 15 seconds, he will partially losing the awareness at that time. Afterwards, he is not able to remember what happened at that time. That is called noogenic epilepsy. Okay, it is very rare type. Many times, many patients may come like this history also, but we have to rule out any anxiety is there or stage fear is there, we have to rule out. But in that patient, we were able to demonstrate epileptic activity, abnormal electrical activity in EEG.
In the EEG.
Yeah. That's how we treated him, because this kind of seizure, this is called reflex seizures. When you are exposed to particular stimulus, you may end up in seizures.
And what about the chewing gum business?
Yeah, chewing gum business.
That is an interesting story.
Yeah, I told you chewing gum business. Okay.
Chewing gum business.
You see, I told you one of guru for we people is a patient. They teach us we people. Okay, so always you should have good ear to listen to patient. Okay.
That's why God has given us 2 ears and 1 mouth to talk less and listen more.
Yeah, he has given 2 ears and he has kept brain inside.
Correct.
People will tell, ಈ ಕೇಳಿಸ್ಕೊಂಡು ಈ ಕಿವಿಲ್ ಬಿಟ್ಬಿಡು, ಆ ಥರ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. It has to go through brain, then it has to come out.
Correct. If at all.
If at all. Okay, so the patient is a very good patient. Okay, and very compliant with medication. He was having primary generalized epilepsy.
And the generalized seizures.
Generalized seizures. Okay, so
and he was on medicines.
He was on medicine. He was on levetiracetam and sodium alpraate, because it was a little bit difficult kind of seizures, but it was well controlled. He was seizure free for 3 years. He was a degree student. Okay, He was very confident. Initially, he was less confident because seizure was free for 3 years. He was very confident. We tell some modification in lifestyle. So we tell avoid driving, swimming, guide, sleep deprivation, everything he was following. Okay. One day he came with his mother and he came, sir, 3 years fits banidilla. Yesterday I had one fit, sir. Then I asked him, you have missed any medications? No, sir, I have not missed any medication. You have any sleep deprivation? No, sir, I will sleep daily 7 hours, sir. I am having fixed time of sleeping. I will go at 11 o'clock, I will get at 6:30, sir. Then I asked her, you had any loose tools? By mistake, without pill would have not observed in past like that only. Told no and loose. Then I told him, you see, seizures was well controlled for 3 years. I am not finding any cause. Okay, either I have to hike up the medication or I have to include one more medication. Just remember, in last 24 hours you have done anything which was unusual.
And then you asked him casually.
I asked him casually. I asked him, okay, because he was anxious because I want to console him. So while consoling, we'll ask so many things. So he told, you say, sir, yesterday I went to mall. Okay.
Mall.
So, mall. Okay. So I took 2 chewing gums because it was boring. I took 2 chewing gums.
So people
then
boring other like chewing gum tirada.
Yeah.
Correct.
Then I asked her, which is the chewing gum? He told some trade name and those things. Then I searched that thing. I purchased also. On that one it is written, warning, it contains aspartame. Contraindicated in patients with phenylketonuria and those people who are having seizures and pregnancy.
My goodness. Chewing gum should not be eaten by epileptics. Can you imagine, guys? And those smart fellows are written there, so you can't blame those guys.
Yeah, you cannot blame them. Okay. Aspartate is a artificial sweetener. After that thing, first time I read about that thing. So you see, that's why it is called practice. We are learning daily.
Correct.
Okay.
Patient is the best textbook.
Best textbook. So then I read it is an artificial sweetener. Okay. There are some studies, but in certain quantity it is allowed. Okay, in food ingredients. But they have mentioned, okay, those who are having phenylketonuria and seizure disorder and pregnancy should avoid it. Okay.
So that chewing gum, that gum he has triggered a seizure.
Most likely it would have triggered seizure. But I didn't increase this seizure medication. He is seizure free. Yeah. There is no recurrence of seizures.
That explains probably
that,
indirectly.
Most likely it is the reason. Okay. So he is now very conscious about that thing. Whenever he is taking food items, chocolate items, everything, every day will lead. You will see the ingredients and warning. That we have to make a habit of that thing. So it's because good to know. What we are eating, we should know.
Correct.
When you are going and purchasing saree or cloth, you will do like this. Oh, the thread sarilla, the sarilla, the sarilla. But you are purchasing food, packed foods without seeing what is there and what is the manufacture date, what is the chemical inside this thing, and you are wearing
expiry
that
thing.
Date, wearing that thing over the head, over the body, but you are eating this inside.
Correct.
Okay, incorporating into body. Okay, so nowadays I will tell all the patients whenever taking these things, these exams are leaving you to patient attendance. We don't know what is the.
Yeah, we don't know. It's good to know because unless simply increasing medicines is of no use.
Yeah.
So you asked him interestingly 3 things: sleep, eating the medicine properly, and any other stress situation. So these.
And one more thing I asked him because it was a generalized epilepsy, was having something called juvenile myoclonic epilepsy. Especially disco lights, like this is eye flashing lights. Okay, then sometimes they can precipitate seizures. When he went to mall, I asked him any film he saw. Okay.
Or those video games, something like that.
Yeah.
So all these are called triggers. So in spite of being on good medicines, in spite of everything, these can still trigger epilepsy. Keep this in mind. If you lose your sleep, don't eat on time, have some flashing lights, this can happen.
Sleep is created by God to restore our neurochemicals. So much wear and tear will be there in the body. It will be corrected in sleep only. Neurotransmitters will also be resynthesized in sleep in minority time. Okay, we are having 2 neurotransmitters, something called glutamate, it excited. One is called GABA, it inhibit. Both should be in balance. If any imbalance occurs, suddenly will throw a seizures. Okay, so sleep is very important.
Sleep is very important. Remember that. Very nice.
Mudde, nidde, both are important. The photic stimulation came in. I am discussing about that.
That flashing light.
Flashing light, chingam.
It's called photic stimulation. PHOTIC.
See, we are having so many stimulation per seizures. Okay. We are
stimulus-induced epilepsy.
Yeah, stimulus-induced epilepsy, or we call reflex epilepsy.
Correct.
Reflex epilepsy. Okay.
Hot water is one of
Yeah,
them.
hot water is one of the common thing, hot water epilepsy.
Correct.
So we are having something called photosensitive epilepsy, especially the primary generalized epilepsy, juvenile myoclonic epilepsy, what we call. Okay, these are photosensitive. When you're exposed to the flashing lights, okay, especially disco lights kind of thing, you will end up in seizures. Okay, I want to tell one incident how stigma attached to the seizures. So around 25-year-old female, she has completed a degree. Okay, she was having her close friend marriage. Okay, so she was accompanying her close friend. You know, the marriage rituals will be there. There will be 2 to 3 days will be there, and they won't sleep properly because she was accompanying the bride. She has also not slept properly. Okay, so reception was ongoing. So in the reception, beside the bride and someone will be there to collect the gifts.
Correct.
So this lady was standing beside the bride to collect all the gifts. We know in our Indian marriage, so much video coverage will be there, and so much
And
cameras
lights.
will be there, flashes of lights will be there. So when our friends come, she also used to stand with them and used to take photos. Okay, so many flashes of lights was happening. She got first episode of GTCS on stage.
My goodness. First time.
First time, generalized tonic-clonic seizures she got on.
Crazy.
Okay, so when they came to me, I asked him, okay, any history of any big seizures like this? Mother told no. That patient also told no. Then I asked her because they told she had not slept for 2 to 3 days properly, and she was standing in the marriage reception. Because we know we in our marriage reception also will be knowing so much flashes of light. At the end of that thing, it is by smiling, we will have we will have a twitching of lips.
Oh, no.
Okay. Then I asked her, so you have some any jerks in the morning hours. Jerks means we call it as myoclonic jerks. Example, like this. Bechbilange. Okay. So early morning hours is very important. There is something called
in sleeper.
No. If that is that different. After you're getting up from sleep, okay. So during awake time, okay, early morning hours, you are having jerks like this. Example, you are brushing, suddenly you will have jerks like this. Okay, you are having coffee tea, suddenly jerks will be having, and that coffee cup will fall. And while writing, suddenly you will have jerks like this. These are called myoclonic jerks. Okay.
And that is different from tics.
That is different from tics. Tics you can suppress. Okay, here you cannot suppress. Okay, it occurs in most common early morning hours and daytime. Okay, these are called myoclonic jerks. I asked her, she told during exam times I used to have jerks like that, sir. Why she was having during exam hour? Because she used to do sleep deprivation. So she was having that myoclonic jerks. Adequate environment was not provided. Yet sleep deprivation and that is photic stimulation was the ideal scenario. So it has precipitated first generalized seizures. Okay, I asked her why you didn't come early. Then she told, sir, I didn't consider these are seizures. These are myoclonic jerks is also one type of seizures. Okay.
Correct.
The problem is.
So Bechbilange is a type of seizure. Not everybody, but just keep it in mind.
Yeah. That is jerks in early morning hours in daytime. Okay. So I counsel them, you take the medication because it will be well controlled with anti-epileptic medication. The thing is, they were accepting that thing. But the main problem is, they are not worried because of seizures. Okay. Mother was telling, you see, sir, ನನಗೆ ಫಿಟ್ಸ್ ಬಂದಿದ್ದಕ್ಕೇನು ಬೇಜಾರಿಲ್ಲ ಸರ್, ಏನೇ ಒಂದು ಮಾತ್ರೆ ಕೊಟ್ಟರೆ ಕಂಟ್ರೋಲ್ ಆಗುತ್ತೆ. ಅಷ್ಟು ಜನ ಮುಂದೆ ನನ್ನ ಮಗಳಿಗೆ ಫಿಟ್ಸ್ ಬಂತಲ್ಲ ಸರ್, ಅವಳು ಮುಂದೆ ಮದುವೆ ಮಾಡ್ಬೇಕು ಸರ್, ಯಾರು ಮದುವೆ ಆಗ್ತಾರೆ ಸರ್? ಓಕೆ, ದಟ್ ಈಸ್ ಸ್ಟಿಗ್ಮಾ ಅಟ್ಯಾಚ್ ವಿತ್ ದಟ್ ಥಿಂಗ್. Okay, because if it would have occurred in home, you would have not revealed to anyone. Now it has occurred in front of public. Everyone knows that thing. She has seizures. So what about her future? Okay, these are the here the mental trauma is more than whatever the GTCS induced physical trauma.
Correct.
Okay, so she was telling, sir, ನನಗೆ ಬೇರೆ ಕಡೆ ಹೋಗಕ್ಕೆ ಮುಖ ತೋರ್ಸಕ್ಕೆ ನಾಚಿಕೆ ಆಗುತ್ತೆ ಸರ್. Okay, so that loneliness will come because we know so much discrimination is there. The self-confidence will come down. Okay, so this is
that stigma has to be broken. I don't know how to do it. Why it is such a strong. Alva, I don't just understand what's going on.
That's why that when you tell stigma, I remember something called Purple Day. Okay, Purple Day we celebrate on March 26th.
That's why you put purple in the brain.
Yeah, we have purple in the brain. So International Epilepsy Day is there, na? International Epilepsy Day is on February 12th. And National Epilepsy Day is on November 17th. And Purple Day is on March 26th. This Purple Day is created by one Canadian girl. Okay,
Canadian girl.
Yeah, Canadian girl. So she was suffering from epilepsy. She felt about seizure, nobody is openly talking. Even the parents are not openly talking.
There.
There also. Okay.
So it's a global phenomenon. It's not
Society also, the culture may be different, but myths will be there everywhere. Okay. So nobody is openly talking about seizure. Because diabetes awareness is so much because everyone is talking about
talking
diabetes.
correct.
If you
Nobody minds going and
if you
relieving.
open Facebook and YouTube, everyone will be telling about diet, everyone will be telling about reversing of diabetes, all these things. How many people are talking about epilepsy or seizures? Okay. Even the patient who is suffering from seizures, then they're not willing to reveal. Okay. And even parents are not willing to learn about that thing and reveal that thing.
Correct.
Even common public is not talking. Once that if public aware is if they knows more about that thing, then whatever that seizure happened in railway station, somebody would have recognized it and would have saved him.
Save the policeman.
Okay.
Papa.
So only way we can save epilepsy patients from accidental injuries, or we can prevent a
How if
discrimination.
he's on crossing the road, it happens in the balcony, he falls on the stove, he falls, a machine onto the machine. It can happen anywhere.
Only way we can decrease discrimination is by educating the people
Awareness
and removing the myths. She started in
Which is what we are doing today.
She started in 2008. This Purple Day. Why she chose Purple Day is International Epilepsy Day. Flower is lavender.
Lavender.
Okay. So it indicates loneliness and isolation. What our epilepsy patients will feel most of the time. Okay. So purple color is the one which should give confidence to them. Okay. And these days what we will do is we in our clinics and everywhere we will use purple color balloons, and patients automatically they will have curiosity why purple colored balloon is used. We tell them this is the thing you should know more about epilepsy. And one thing I want to tell, my first son birthday is on November 17th. That is National Epilepsy Day.
Interesting.
And second son birthday is on February 12th.
What?
Yeah.
Are you serious?
Yeah.
Are you match fix
Illa. So I will make sure that I will make sure that purple balloon used for decoration. So everyone will,
father is epileptologist. Both sons are, I mean, it's too much. It can't be coincidence.
So whenever we do decoration for birthday, I will make sure that only purple balloon is used.
Very interesting.
Okay,
I have never observed that. I didn't
I will send you photo.
Sure.
So people will love, because my children friends will come, their parents will come, our relatives will come.
Them. They will ask.
Everyone will have, because any birthday they will having so many color balloons will be there. One white color, yellow color, red color, like that. Why this fellow is only using purple color? They will have that curiosity. Conversation starts. There I will talk about epilepsy.
Fantastic.
Okay, we can educate. Epilepsy is like any other disorder. Okay, because it is common in children, at least the parents will be knowing. Okay, so that
very nice. So it gives you an opportunity to create awareness. So what does this poster say? Anybody with a brain can have a seizure. What do you mean? Why did you want this message to go out to the public?
Because the thing is, you see, I told you initially, I am speaking with you, you are seeing me, you are listening to me, everything is because of electrical activity.
Correct.
Whichever the brain is having electrical activity, it can have short circuit and can have seizure.
So that means you can have a seizure, I can have a
seizure. You see, if you take...
Again, democratic disease. It doesn't distinguish.
If you take a population, 0.5 to 1% of population will have seizure, epilepsy. If you are having 1,000 population, is there 10 people will have epilepsy. And your lifetime risk is 1 in 26 will have seizure.
1 in 26?
Yes, 1 in 26.
That's a high number.
Yeah, okay. And anybody can have seizures. Any animal, even dog can have seizures.
Correct.
Because it is also having brain, it is moving.
Correct.
Okay, moving is because of electrical activity inside brain. Even cats get seizures. Okay, so anybody who is having brain, they can help the seizure patient also. Okay.
So to remove the ignorance and the myth is educating that brain and getting the software inside to make that happen.
Correct.
So now, when before I go down that path we were going, whenever you have this GTCS, these seizures that's happening, they want to keep, keychain, they pick up a keychain and they give it in the head, thinking that the keychain will stop seizure. And people even today, educated people are putting a keychain in people's hand. What is this keychain got to do with the seizure control and all that? That's what I put up in my poster, But what is this keychain business?
Keychain is not going to stop seizure. Okay, education about a seizure is the one which is going to stop seizures.
But tell them, stop doing this keychain business.
Yeah, there are so many myths I told you. Now, the one of the myth is, whenever they are having seizures, if they hold keychain or iron content, it will subside like that. They are having it. It's a myth. Okay, it is common in South India. In North India, where I did my MD medicine, there they commonly use shoe smell. They use sock. Yeah.
Really?
Yeah, shoe smell and sock smells. They will take a shoe or socks, they make them to smell. They will take onion and make them to smell. Okay, it depends on the different area. It may be different. It is culturally, it may be different. In South India, most commonly they will give key. I want to tell you, one patient came with an iron ring in the hand, my seizure patient. I asked him, why you are wearing this iron ring, man? Sir, everyone will give key, that's why I am wearing iron ring only. Then I told, you see, man, if it is like that, then I would have given keychain for everyone.
Everybody.
Like that. So the thing is, he is also not wrong, because we are born and brought up in that belief. If before joining MBBS also, I would have also done same thing only, because I am ignorant
the
about
same
that
community.
thing. That is ignorant. Okay, I was having apasmara. That is ignorant about that thing.
Correct.
Okay, so there is no fault in them also, because of the poor education, that they're not
Awareness.
yeah, education different, awareness is different. They may be having graduate, they may be MSc, MA holder, maybe, but that awareness is different. They also will tell give key only like that. Okay, so
That's the difference. Since you said it just as a lighter vein, the degree we get is called literacy. Education is. I know a cardiologist used to beat up his wife.
correct.
What's the point of being a cardiologist of beating up your wife?
That's
right. What do you want to do that for? You have to hang him upside down, or what is it? I don't know.
That's I remember. So education in this sense, not what we are getting degree. Okay, there is Samskrita Subhashita there. I learnt in 8th standard. That is the only Subhashita still I remember. Because I have forgotten everything. Sanskrit thing. Vidya dadati vinayam.
Correct.
Vinayat yati patratam. Patratvadu dhanamotpoti dhana dharmam tatasukam. See, education should give you humility. Humility will give you worthiness. With worthiness, your religion, dharma, and your family and surrounding people will be happy. So, we have to ask ourselves, our education is giving humility. So, the person who is coming from the village will be listening to we people more than the person who is graduate. Okay. So, once it comes to, I know, I have searched everything in Google, I know everything, and then this doctor, just I have come here to clarify my doubts. Like that type attitude if you go. Okay. So, if you want to...
Googleitis.
Yeah. So, my teacher used to tell, I have to remember him, his name is Marusudappa Master. He was in my 3rd standard, 4th standard. He used to tell me, Shreedhara, ನೀನು ಓದಕ್ಕಿಂತ ಮುಂಚೆ ನಿನಗೆ ಏನೂ ಗೊತ್ತಿಲ್ಲ ಅಂತಲೇ ಓದು. 10 ಸರಿ ಓದಿ ನಿನಗೆ ಬರ್ತಾ ಇರ್ಬೋದು. ಮತ್ತು ಓದಕ್ಕಾರ ನನಗಿನ್ನು ಓದಿಲ್ಲ ಅಂತ ಅಂದ್ಕೊಂಡೆ ಓದು. Each time you have to...
Amazing.
Yeah. He used to tell...
a simple way of... Amazing.
Well, you can fill the part only if it is empty.
Correct.
If you think already part is fully, you cannot pull anything in that one. Okay. To gain the knowledge, you should have emptiness in your brain. Okay. Even if you are having more knowledge, you should tell, I don't know anything. Then only you can perceive.
Learn new things.
Learn new things. If you know everything, then that is the day of deterioration.
Absolutely. Amazing.
So, before going to EEG, okay. So many innovation has occurred because of curiosity in our brain. So, we are the human being is the one who is having curiosity when compared to other animals. Curiosity is the one which has resulted in so many inventions. If you see, in last 40 years, scientific innovation, you see so many things because of curiosity only was identified. So, I want to tell on Kagga. Okay. So, ಅಜ್ಞಾತವಾದುದನ್ನು ಅಭಾವವೇನೆ ನಾಸ್ತಿಕನು, ಆಗ್ನೇಯವೆಂದು ಕೈಮುಗಿಯ ಭಕ್ತ, ಜಿಜ್ಞಾಸ ಎಂದು ಪರಿಕಿಸತೊಡಗೆ ವಿಜ್ಞಾನಿ, ಸ್ವಜ್ಞಪ್ತಿ ಶೋಧಿ ಮನಿ ಮುಂಕುತಿಮ್ಮ. That means ಅಜ್ಞಾತವಾದನು ಅಭಾವವೇನೆ ನಾಸ್ತಿಕನು. You see, air is there here because I am inhaling through perception. That's why air is there, surviving. But if atheist will tell, oh, it is not visible, that way it is not exist. But he is not able to feel that thing. Okay, atheist is the one is not able to feel. It is not visible for his 5 senses. That's why he tells it is not existent. Okay, but bhakta is not like, devotee is not like that. It is behind my 5 sense comprehension. Because of that thing, it is God. Okay, because of that thing, it is God. Correct. That is, he is a devotee. Okay, so atheist is, it tell 5 senses it is not detected in my 5 sense. It is not there. That's all. Okay, so then comes scientist. Scientist is little bit different. Parikisatodage vignani, jignasi endu parikisatodage vignani. Something is there, which is not detected by my 5 senses. But I have to do some innovations, so that I can detect what is the exact idea behind this. That is scientist. So end up in many innovations. Swagnapti shodhi munkutima. Scientist is the one, you will see what is the essence of life. why I have come here. He will turn inwards, okay, and try to attain moksha. So scientist, why I am telling is, it is a story of that scientist. His name is John Berger.
EEG, ECG, all of these are. What is EEG? Can you tell our viewers what EEG is?
See, ECG means what? Electrocardiogram, electrical activity we are recording. With
Other electrical
surface.
activity.
It is electrical. Art is also having electrical activity.
Correct.
Everywhere where in our body is electrical activity only. It is in microvolt. That's why there is no, on touching there is no shock.
Correct.
Okay. So in EEG also, we are measuring brain activity with surface electrodes.
What is EEG expansion?
Electroencephalography. Okay.
Encephalo is the Greek
That
word.
EEG machine. EEG machine is also, the discovery is, invention is also having so much history. We have to give due credit for that fellow.
Please tell our viewers.
His name is Hans Berger. Okay. He is German. And you see, destiny will be different. He wanted to become astronomer. Okay. Finally became a medical person. Okay. Why? There was an incident. Okay. So he was serving in the German army. I think in German army. Okay. In cavalry unit he was working. So he was riding a horse in battlefield. They will be doing practice. Na?
Correct.
Okay. So they were practicing. Okay. So he was in camp. I think he was practicing there. So he was on horse. Suddenly fell down from the horse. How he fell down? In the way of horse-drawn cannon was coming in that way. It was coming very fast. Okay. So he fell down. The horse-drawn cannon was coming. Just it has to run over him. Suddenly that horse-drawn the over controlling that cannon stopped that thing. Okay. So here a near-death experience for him.
NDE.
Near-death experience for him.
Oh,
Okay.
that's a topic by itself. NDE is a topic by itself.
Okay. Now ಬಾಯಿ ಬಂದ್ಬಿಟ್ಟಿತ್ತು ಅಂತ ಅಂತೀವಲ್ಲ.
Correct.
So like that. So that is acute. You will be having so much palpitations, everything, sweating, everything. Then he recovered from that thing. So anyhow, it escaped. Now ಕನ್ನಡದಲ್ಲಿ ಕಂಟಕ ಅಂತೀವಿ. So that day he got one telegram from his sister. Okay.
Same day.
Same day. How are you? How is your health? How is your health? I felt that something has happened to you.
Are you telegram?
Yeah,
that means
telegram.
She must have sent it 1 or 2 days in advance.
No. On that day only she has sent.
No, I know, but telegram takes some time.
Yeah. Okay. So she was living around more than 1,000 kilometers away from him. Okay. And that day only she felt, okay, when incidents happened, that day only she felt something has happened to my brother. So when I got telegram, he was astonished. How come my sister came to know my incidents? She is asking whether I am fine or not. That means something has happened. It is beyond our comprehension. It's beyond 5 senses. When I fell down, some energy, psychic energy would have released from my brain in wave form. From brain activity, some psychic energy would have released. It has traveled there. And my sister acted as a receiver. So whatever the pain I was going, that whatever the thing has happened, it has struck and it is received by my sister. So I have to find out this psychic energy. Okay, that is the stimulation for him to become doctor. After completing his compulsory service, he joins medical course. He become doctors, and primarily he wanted to look for psychic energy. That's why he innovated the EEG machine. He will record the surface electrodes. With surface electrodes, he will records. First human EEG was recorded by him in 1924. The waves recorded by him is called alpha waves, Berger waves. We call Berger waves. Okay. The thing is, whenever I am sitting like this, I am conscious. Okay. I am having wandering mind, not concentrating on anything. So we are having some waves called alpha waves in EEG. That is 8 to 10 hertz waves. If I open eyes, it will disappear.
Oh.
If you ask me a question, if I answer, it will disappear. They are called alpha waves. Okay. So that is the first wave demonstrated by him. So as a compliment to him, we call it as Berger waves. But in science, it happens. Even after invention also, that credit will take long time. Okay, after 4 to 5 years only scientific community, I think, accepted. I am not able to remember. But it took long time for scientific community to accept. Anyhow, the psychic energy concept ended in invention of EEG. Nowadays, we are using left and right EEG. And it has helped a lot in localization of the seizures. Okay, we have to remember those kind of scientists. Okay, he was a little bit disappointed, I think, because he was not able to find. But at the same time, he gave one invention to neurological community.
So how many, since you brought up the alpha waves, how many waves are there on EEG? Just for yarn for our listeners.
Commonly we tell alpha waves, beta waves, theta waves and delta waves. Okay, alpha waves, example, when I close eyes my mind is wandering, we'll get alpha waves. Suddenly when I become anxious, when I'm conscious, sometimes beta activity will come. Okay, so when I'm sleeping, okay, theta and delta waves are common. Depending on example, patient is having some depending on this wave form, will tell the patient is how is the electrical activity inside the brain. Depending on the voltage also will tell how much electrical activity is inside the brain. Okay.
Got it.
And in seizures, mainly we see something called spike. Okay, there is abnormal electrical activity inside the brain. That's what we want to identify. So that's why it will not be continuously producing.
Correct.
It will come like this and go. Okay, that's why when we do 100 patient EEG, 50 to 60% may be positive for epilepsy. Epileptic abnormality we may see. But in 50 to 60% it may be normal also. Many times patients will ask, you say sir, you are diagnosed as seizure, I am on medication, even single time EEG has not come abnormal, my MRI brain is normal. Yes, it is correct. During the recording EEG, the abnormal electrical activity is not produced. That is one thing. That is one explanation. Second explanation is EEG cannot record everything. Okay, if it is deep surface is there, example, if you are in brain, if under surface is there, medial surface is there,
It's not reaching.
it is not reaching your electrodes. Okay, many times that's why some concept of invasive EEG, all these things come.
We have spoken about
Yeah,
it.
yeah.
So what you are saying for the benefit of our audience is we have 4 waves which comes at different times. They're all normal.
Yeah.
So in between these 4 waves, you get spikes, which is suggestive of epileptic activity. Now there's some 20 pages, 30 pages, 50 pages
See,
of that. You guys have to
waves
focus.
we tell normal, abnormal, depending on the clinical scenario.
Correct. Oh,
Example,
I see. Okay.
patient is in ICU, okay, is not responding for your commands.
Correct.
Okay,
Unconscious, coma.
unconscious, coma patient, in his electrical activity is low or voltage is low.
Low.
Then is there is this brain is working very low.
Slowly. Correct.
Okay.
Correct.
If his example patient is walking, talking patient, he may be having some lesion in the right hospital area. Okay. Because of that thing, that side of alpha waves may be slow. Okay. So we have to always, before telling they are normal or abnormal,
Correlated
okay, we have to
clinically.
correlate clinically.
Got it. That and into what we say, see, I was just going to ask you that question. So many times what happens, patient has a seizure and comes to the neurologist as for evaluation. We do a EEG, it can be normal. What does it mean? Number one, normally within 24 hours EEG will become normal, or what is the 12 hours, 24 hours?
It is very difficult to predict.
Yeah.
Okay.
So if you don't come immediately, the EEG could have become normal past by the time you have come. That doesn't mean.
The thing is, so sometimes immediately after seizures, example, patient has generalized tonic-clonic seizures, it indicates brain is exhausted. If you do EEG at that time, it may be normal, or it may be only one slowing may be seen.
Yeah, correct. Post-ictal slowing.
Post-ictal slowing, because it has to reactivate.
Correct.
Then only it can able to produce spikes. Okay, sometimes immediately after seizure it can be normal also. Okay.
So it doesn't mean anything. So what Dr. Shreedhar is saying is, seizure is a clinical diagnosis. Once you do this, we have to establish the seizure by doing electrophysiology, which is the EEG. EEG can be normal, can be abnormal. Abnormal, it's very easy for us to figure it out. If it is normal, doesn't mean you have not had a seizure. And how do you diagnose? Like you said, we have to do more invasive things. Wait for the next episode. In that episode, we are talking about all these invasive episodes with Dr. Dinesh Naik and Dr. Ravi Mohan Rao about depth electrodes, about video EEG. We've spoken about all of those things there.
If EEG abnormality is there, it indicates the chance of seizures are more. 2 times it will increase your risk. That is more important.
Got it.
Okay.
So if an EEG is abnormal, I have a follow-up question to you. So do you, after starting medication, would you want to repeat an EEG again to make sure it's become normal? Is that a part of
Usually we go
mandatory?
clinically because we usually practice more of clinically. We ask symptoms. If patient is not having symptoms, we won't
Not
repeat the
necessary.
EEG. Example, patient is having juvenile myoclonic epilepsy, is not having seizures since last 3 years. If you do EEG, he may be having spikes. But it may not interfering with this day-to-day activity, it not producing the seizures. But we should not over-treat the spikes. Okay, clinically we have to correlate. If clinically it's no seizures, there is no need of aggressive treatment.
Got it.
Okay.
So now coming back to the AEDs, anti-epileptic drugs, or the strategies. What are the normal strategies do's and don'ts that you as an epileptologist keeps in mind when you decide on the medicine? And you want one medicine, two medicine, how do you dose? What is the strategy?
Strategy is, again, it depends on the patient age, whether she is a female or male. Okay, in children we may choose different, and elderly individuals we may choose different. In the pregnant females we may choose different, and female planning per pregnancy will be different. Okay, and patients have comorbidities. Example, patient is having cardiac arrhythmias and he is having some antiarrhythmic drugs. In those patients we'll choose certain other
So
medication.
it's not just that depending on the mood, you just write one medicine and
If
go.
patient is having liver issues, we have to give they won't affect the liver. If kidney issues is there, we have to give the medication. They are safe, because we have to take into account of the phenotype and his comorbidities. Then we have to start a medication.
Got it. So let us start with the GTCS, for example, the grand mal or the primary generalized epilepsy, which is probably the commonest that our audience know. So what would be, you always start with one medicine? That's the normal strategy that you have?
Always in our epilepsy teaching is always start with one medication.
So
You hike up the
monotherapy.
medication according to body weight. Okay. In spite of that thing, if he is having a recurrence and he is compliant with medication, if they are not compliant with medication, no use of adding second medication.
Correct.
But you make sure that he is compliant with medication and he is avoiding the risk factors also, precipitating factors
The
also
trigger
avoiding.
factor, yeah.
Okay. So in spite of avoiding trigger factors and compliance with medication, if he is getting seizure, go to maximum dose of single AED, which is a tolerated doses. Okay. If it is not working out, then you have to introduce second medication. Second medication,
Is it you will stop the first and start the second, or
the
you will add?
strategy
Is
will
it
be
an add-on?
different. Example,
Strategy will be different.
example, patient was having seizures. By first medication, 50% of seizure has come down. That is, it has worked.
Correct.
But it may not that much efficient.
Like a BP and sugar tablets.
Yeah. So we add another medication.
Got it.
Okay. So example, patient is taking amlodipine. If BP is not well controlled, we add hydrochlorothiazide. Similar to that thing, in second medication we'll add. So we choose that certain additive effect will be there. Okay. So the second medication will like up. So two medication in combinations will give.
Got
If
it.
first medication we have started, but there is no decrease in seizures, what we will do is we introduce second medication, gradually we drop first medication. Okay.
So never stop the medicine suddenly for any reason. So he used a very important word called compliance. I don't think there's any other medical problem where compliance plays such a big role in management of the symptoms as in epilepsy, from what I can see at least. So always remember, timing is important. See, you see sometimes some tablets are given once a day, sometimes are given twice a day. Why is that, Shreedhar? Why are we confused? Are we confusing patients? Or why are these things? Why can't the pharma companies make medicines in one type easy for us to dose? Can you educate our audience? Why this 3 times, 2 times, 1 time?
You see, in our village, we are having one habit. When we were children, we used to have ragi balls. If you eat ragi balls till night, you no need of any
Correct, concrete,
lunch is not needed.
correct.
It will take long time to digest. If you are eating rice, you may need three
Correct,
times
3 hours.
because easily it will digest. Okay, the duration of food is there. Okay, similarly, whatever the medication we are prescribing, there's something called off-life of medication.
Plasma half-life.
Plasma half-life, how many hours it is staying in particular
In the blood,
concentration.
correct.
Okay, some medications will act per 24 hours. Some medication will act per 48 to 96 hours. Some medication acts per 12 hours. Okay, we are having so many medication. Example, phenytoin is there, it will act per 24 hours. Phenobarbital is there, it can act up to 3 to 4 days also. Okay, but if you are having commonly prescribed levetiracetam, it acts per 12 hours. Okay, so depending on what is the duration of action, we will give BD dose, twice daily dose, once daily dose. Okay, is depends on the medication molecule. It depends. Okay.
So what Dr. Shreedhar is trying to say is, when we say twice a day, Shreedhar, my next follow-up question is simple. See, sometimes what happens, when morning and evening antibiotic, for example, is given to me. Sometimes I may swallow 7 o'clock in the morning. In the night, I'll come back 9 o'clock, 9:30. I take it after dinner, go to bed. So twice a day, no? Anyway, I've taken twice a day. Because that's the way most of us medicate ourselves. Let's be honest about it, including doctors like you and me. Does that logic work in epileptic medications?
No, I will always give example for the patients. You have taken breakfast at 8 o'clock. So can you take lunch at evening 9 p.m. and dinner at 10 p.m.? No, it is not possible. No? So similar to that thing, okay, there's something called buffer zone. Okay, you can make 30 minutes 1 hour आगे पीछे कर सकता है. You can make half an hour आगे पीछे. The thing is you have to take in time. I always tell you, people use mobile for so many unnecessary things. Okay, you keep alarm, or we are having so many applications, still remaining applications also there. You keep. And many people will tell, especially the females, the homemakers, because they will forgetting in so many times. I will tell them, you in paper you take a printout. I have to take a pills. You wherever you are working, you paste there. Example, your kitchen you place there. So whenever you say, oh, I have not taken, you will remind. It will remember. Okay, like that I will tell. And many people I will tell, always make sure that in your pocket you will have two to three tablets. Okay, even if forget also, when you remember, immediately you can take. Because some medications are coming in scheduled medications. If you go and ask without prescription, they may not give. Okay, so you keep in purse. Okay, so whenever you if forget, by the time you reach office, you may remember, oh, I have not taken. At that time you take the medication. So I make sure that all the patients is having at least 2 to 3 tablets with them.
So what Dr. Shreedhar is saying, what we do normally as neurosurgeons, neurologists says, some tablets only we write the time below the medicine dosing. Every tablet we don't write. So this is this and movement disorders are two places where we write the time very specific, because we want to time the medicine correct for the maximum benefit and minimize the side effects. So normally when you say twice a day, you fix a time, 8 a.m., 8 p.m., 9 a.m., 9 p.m., whatever, 2 days, 2 times, and same time every day. Because when he said the effect lasts for 12 hours, within 12 hours, the next dose has to go plus minus half an hour, like he said. Otherwise, even if you take 2 hours later, when the medicine dips, you can have a seizure. So now there's no point increasing the medicines. I have a classical story of one of my patients who came. He was a known epileptic, taking medicines. I thought he was a reasonably compliant guy. One day came with a seizure. So I asked the mother, how's he thought? So regular thought. And she looked quite convinced about that. So then I asked him the question, and after he settled, ನನ್ನ ರೆಗ್ಯುಲರ್ ತೊಗೋತೀನಿ ಡಾಕ್ಟ್ರೆ, ನನ್ನ ರಾತ್ರಿ ತೊಗೊಂಡೆ ಸರ್, ನನ್ನ ರಾತ್ರಿ 1 dose ಮಿಸ್ ಆಯ್ತು. So this is like daily wages, guys. Account has to be settled every day. There is no carry-over system. I tell you, have to take. So that 1 dose he missed, all the 2 years he was compliant and seizure-free, didn't make any difference. He threw a seizure, then all that is a waste. So remember that. Like Shreedhar said, sir, always have the medicine physically on your body at any time you travel, because thanks to Bangalore traffic, you may not reach home by 8 o'clock. So wherever you are, 8 o'clock, alarm rings on your phone, pop the tablet inside. Bari hotel toneno, I don't think our AEDs makes a big difference. So don't think that you have to have dinner, then you take it. I was on, upvasa, idu, adu. None of that makes a difference. Please take it correctly. That is very, very important. And always have one, I would have 1 month stock. Because stock sometimes doesn't go. I've also seen, Shreedhar, when you change the brand name sometimes throws you. Yeah. What's your experience with that?
That is in our epilepsy journal it was published. Okay, because the concentration of drug, the impurities in drug may vary from manufacturer to manufacturer. Usually we tell not to change the trade name.
Correct.
Okay, we'll always write generic name in bracket. Okay, because some patients may be having affordability issues. Many people will purchase generic drugs.
Correct.
Rather than not taking medication, it's better to take the medication. But whoever is affordable, we tell them don't change the brand name. Okay, because we have ourselves we have noticed it. Even though good company drugs, when they change from one company to another company, they have ended up in seizures. And always I tell breakthrough seizures. Many times people will take what will happen with one seizure. So I will tell ಬೂದಿ ಮುಚ್ಚಿದ ಕೆಂಡ ಅಂತೀವಿ ಕನ್ನಡದಲ್ಲಿ. ಬೂದಿ ಮುಚ್ಚಿದ ಕೆಂಡ ಮೀನ್ಸ್ to see everything, it look the fire look like it is extinguished, but
the ash on top.
Yeah, ash on top. Just if you do like that, fire will come. Okay, it is
what
like that.
Example.
Yeah.
Brilliant example.
Yeah.
Brilliant
see
example.
whatever the medication we are using, we are not curing that thing, we are suppressing the seizure act. The abnormal electrical activity is there. Okay, so we are suppressing abnormal activity. Okay, if wire is
managing it or controlling it.
If wire is having discontinuity, you may get electric shock. We are insulating with tape, but we are not changing the wire. Okay, similar to that thing, we are giving the medication so that abnormal electrical activity is suppressed. Till that medication is there in your body, it is suppressed. Once medication is out, you will sit and stand. Okay, I will do whatever I want. Okay, many times what will happen, well-controlled seizure patients, they will end up in status epilepticus. And
Oh, it becomes very difficult to control.
very
Some
bit
of them have
difficult.
said, we have struggled in the ICU to control it.
So he was not
I
having
can
seizure for
imagine.
3 years. He missed a dose, and he presented with multiple episodes of
I
seizures. We had
agree.
difficulty
Sometimes
with
they can die.
one medications we were
Yes.
controlling. Now we are using 2 medications. So it is like making the demon who was sleeping and you making him to stand up and dance. Okay. Always I tell the patients not to stop the medication abruptly. Okay. You have to, even if you are seizure
ಅಯ್ಯೋ ಯಾರ ಎಲ್ಲ ವೆಲ್ ವಿಷರ್ಸ್ ಸುಮ್ಮನೆ ಡಾಕ್ಟರ್ ಬರೀತಾರೆ ಚೆನ್ನಾಗಿದೆ ತಾನೆ ನಿಲ್ಲಿಸ್ಬಿಡು ನನ್ನ ಮಾತು ಕೇಳಿ ನೀನು
Yeah, I
ಏನೂ
will
ಆಗಲ್ಲ
always
ಅಲ್ವಾ ಸುಮ್ಮನೆ ಔಷಧಿ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು
yeah,
ಎಲ್ಲ ಹೇಳ್ಬಿಟ್ಟು
I always
ಪ್ಲಸ್
tell
ಪ್ಲಸ್ ಆಯ್ತಲ್ಲ
whenever stopping, you go and meet your clinician, and slowly they will taper and stop. They will outweigh the benefit and risk. Okay, what is the seizure recurrence risk?
Absolutely.
Okay, we have to see.
Depends on how many times he's had seizure,
Yeah,
how
yeah.
difficult it is for us to stop the seizure, all and how abnormal, normal the EG was. So many factors we have to see and wait, alwa.
Yeah, so we have to very cautious before
Absolutely.
starting the medication.
Because what Dr. Shreedhar is trying to say and what I am also trying to say is, why do you have to be overcautious, guys? Because like he said, one seizure can kill you. This
Yeah,
is
we
the
saw that.
bottom
No?
line. This is you saw that seizure, the constable, you may be an electrician, you might have climbed a ladder on top, you didn't take it, you fall from top, you can die. You may be a machine turner standing in front of a machine is running, you fall onto the machine, you can die. You're getting down from the bus, you fall down.
See,
I still remember
we
one
have
Hanumantagarale, there was one BMTC bus driver who was driving the bus on a crowded Hanumantagar main road, had a seizure, lost control of the bus, went on the footpath, and 6 bystanders died.
Correct.
6 of them.
We have seen so many homemaker because they will be working in front of the
Stove.
gas stove.
Correct.
So they had this unaware seizures, the focal unaware seizure, like this. Finally, they're catching the fire, and the fire has catch the saree also. They have burnt their body parts also. Just 5 days back, I saw one child in hospital. He went to take bath. Okay, so that hot water tap was on. Suddenly, he got seizure and fell down. It was locked from inside. So he has fell down on right lateral side. So hot water was overflowing. For 20-30 minutes is overflowed.
My
Okay.
goodness.
He has complete burn injury on right side of the face, right of the leg, right side of the hand.
Chandra.
He was having scarring. It happened 2 years back. Now he has come for follow-up. Okay. So what I'm telling, this is disfigurement is there. It will lifelong, they will remember that thing. In seizures, as I told initially, if seizure occurs in abnormal place, you will end up in disfigurement, or you may end up in fracture, you may end up in losing the life also.
I have seen enough patients, one seizure, GTC, Shreedhar, they've broken their spine, humerus fracture, how many fractures of big bones, not in small bones at the end of the day. So we are going, see, and I always tell them, when you have had a seizure, any activity that puts your life at risk or somebody else's life at risk, which is driving, swimming, you should avoid. The moment I say this, many of for me, see, the kind of epileptics that you see and we see are very different. The commonest I see is post-head injury, and majority of these post-head injury guys are drivers. They want to get back to driving after they recover. Now, I say you're not fit to drive because of epilepsy. ಅವ್ನು ಏನು ಸರ್ ಹೊಟ್ಟೆ ಮೇಲೆ ಹೊಡೆದಾಗ ಹೊಡಿತೀರಾ ಸರ್ ನೀವು ಏನು ಸರ್ ನಾವು ಬೇರೆ ಹೊಟ್ಟೆ ಪಾಡು ಮಾಡ್ಬೇಕು ಸರ್ ಹಿಂಗೆ ಅಂತ ಸಮ್ ಆಫ್ ದಮ್ ಆರ್ ಡ್ರೈವಿಂಗ್ ವಿತೌಟ್ ಅವರ್ ಪರ್ಮಿಷನ್ ಅಪ್ಪ ಐ ಟೆಲ್ ಹಿಮ್ ನೀನು ಡ್ರೈವ್ ಮಾಡ್ತಾ ಇದ್ದಾಗ 1 ಸೆಕೆಂಡ್ ಹಿಂಗೆ ಹಂಗ್ಬಿಟ್ಟು ಹೋಗಿ ಗುದ್ದಿದ್ರೆ ನಿನಗೂ ಒಳಗಾಗ್ತಾರೆ ನನಗೂ ಒಳಗಾಗ್ತಾರೆ. ದೆಲ್ ಪುಟ್ ಯು ಆಲ್ಸೋ ಇನ್ ಜೈಲ್, ದೆಲ್ ಪುಟ್ ದ ಡಾಕ್ಟರ್ ಆಲ್ಸೋ ಇನ್ ಜೈಲ್ ಬಿಕಾಸ್ ಹೂ ಗೇವ್ ಹಿಮ್ ದಿ ಕ್ಲಿಯರೆನ್ಸ್ ಟು ಡ್ರೈವ್. So I have to give a letter saying that non-driving activity. So tell us about, is there Indian laws that prevents people from driving or epilepsy, and can we justify that so that they can change their occupation? Is there something like that?
In India, we are having Motor Vehicle Act 1988. Irrespective of the seizure, whether you had single seizure or you are having multiple seizure, or it is a brief seizure, it is a big seizure or small seizure, if you are having any history of seizure, you are not eligible for driving license.
For life? Oh, not eligible for driving license at all?
Not at all. So in driving license application, there will be at any point of time you had seizure. If you write yes, you will be not issued.
And suppose you already have and then get a seizure, then what happens?
See, normally when the people come to me, people will tell, so you see, according to the rules, okay, so according to Indian Driving Act, even if you are having driving license, if you had seizure, automatically you think it is cancelled. Okay, if you commit any accident, so in spite of knowing you are having seizure disorder, you have driven the vehicle, you are guilty from your part.
Correct.
Okay.
And see, it can be a 1 second.
Yeah. So we are
It
having
can be a child crossing the road. It could be your child. It can be
yes.
my child. It can be anybody's child.
So what law will says whether you are done purposefully or not. You are knowing you are having seizures. Why you are driving the vehicle? Okay, I will tell all the patients. I will tell, even though you are having driving license. Okay, if you are having seizure means you remember it is cancelled.
That's
Okay,
a nice dialogue. I
okay,
think I
it
can
is
also use
cancelled.
it in that.
Even if you are having, it is
Assume it's like
cancelled.
a cancel.
Okay, you may be taking for SIM purpose. You may use that thing. Okay, for some ID purpose
ID
you can
purpose.
use that thing. But if you are having seizure means you remember it is ideally cancelled. Okay, so you should not drive. Okay.
So why is he saying so strongly is any activity that puts your life at risk and other people's life at risk. I'll give you one of my own patient's story. He was a head injury guy, and he had one seizure during the head injury treatment. I had given him for 5 years, okay, and everything was fine. I did an EEG before stopping medicines. EEG was fine. I tapered, I stopped, everything was done. Maybe 9 months to 1 year after the seizure, after the medicines were stopped, he is driving with his family in a Premier Padmini car to Belkote, Sarana. 5.5 hours he is driven from Bangalore. He has just reached Melkote and pulled the car to a side. He had a GTCS.
Correct, sir.
I told Nin Adrishta Chanagito, 1 minute more on the highway if you had had, God only knows what would have happened to you and your family.
Yes, sir.
1 minute before that.
See, what patients feels is right to drive is that is driving. If they're not able to drive, they feel like they have lost one.
Correct. They are paralyzed,
They're
literally.
like a paralyzed. Everywhere they have to use public transport or they have to book some private vehicle like
Correct.
that. That is the most common thing they will tell. But the thing is, we have to think of public safety also.
Absolutely.
This safety also and other safety also is very important.
I think so.
I tell
think
all the
so.
patients this is the thing, but many people still drive. But I want to tell through this media they should not drive. Okay.
Yeah,
So,
please guys, don't drive. It is not worth it. Because you may land up killing your own child. Who knows where it is? Alva, karma chanagilla, it could be happen to anybody. Your own father, your own mother, somebody's father, somebody's mother, somebody's child. Please understand. You are maybe on a suicide mission with your epilepsy, but don't kill somebody else. It's as bad as drinking and driving at the end of the day.
okay, many patients tell, sir, you are telling epilepsy person can live normally like any person, but you are telling me to avoid driving. I will tell, see, if you are having diabetes, we tell not to eat sweet food. Okay, do too much dieting, we tell. If you are having renal problem, we tell so many modification. Driving is one thing we are telling modification. How many, what we will tell most of the seizure patient, 2 or 3 instructions only there. Avoid sleep deprivation. Okay.
Eat
Avoid sleep deprivation. Take medication properly. Avoid heights where the safety measures is not there. Avoid open fire. These are the things we tell. So here there is no rigorous dieting is not there.
Exactly.
Whatever you want you can eat. Okay, only 1 or 2 medications you are having and least side effect of medication. For this thing you no need to change your diet style, and no need to go to neurologist again and again also.
Correct.
No need of doing blood sugar every 15 days once. Okay, so 3 months, 6 months, if it well controlled, 3 months, 6 months, even 1 year once you can go to your doctor. Okay, so relatively, I always tell the patients, you see, if God comes and stands in front of me, he will tell, you see, Dr. Shreedhar, you are a human being. Human being is bound to suffer from disease.
Correct.
Okay, I am having some option for you. So I am having diabetes. I am having acute MI. I am having stroke, renal problem, and seizure. Which one you want? Okay, I will tell God, I don't want anything. Okay, no. You should have one disease because you are a human being. I have to give. Then I will tell you give me seizure. Okay, it is well controlled with medication. Okay, so no need of any modification. Only thing is I should not drive. Okay, and I have to sleep properly. I will sleep more than 8 hours anyhow. Okay, so I will always tell the patients. So rather than having the diseases which damage the kidney, liver, nerves, all those things. Okay, and it disables you. Okay, you cannot enjoy your normal life also. Okay, if seizure is well controlled, you should be happy. Okay, you should this soapillosis because diabetic complication is having amputation of leg. Okay, because MI is having ejection fraction of 20% is not able to walk 10 feet.
Correct.
Okay, you should always compare like that. Okay, so the person who is not having shoes, you should compare with them who is not having limbs. That was my father used to tell.
When I was a child, there was Reader Digest used to read and said, I was crying that I had no shoes on my feet until I met a man with no feet. That's exactly what you said.
Yeah, that's what. So You see, if 100 epilepsy patients are there, 70% of the patients are well controlled with
I
medication.
agree.
30% in every disease it will be there. Okay, so 30% difficult control will be there, but 70% can have normal life.
Normal life.
Okay, that is a big number.
I
70%
agree.
is a big number.
I agree.
Okay, so that is a thing.
I want to say two more things. Before I say those two things, John T. Rhodes, the famous South African cricketer who was known for that muscular movement in the field, was an epileptic, on treatment, very well controlled. If you go to Google and search John T. Rhodes, he's given so many messages on epilepsy. Please understand, at the highest level he has performed. So you can be the next John T. Rhodes. But
Yeah.
like about God, you said, no, I always tell my patients the same thing. In your lifetime, you can't say, God, don't give me disease. But if you get a disease, you should get a disease that is diagnosable.
Diagnosable and controllable.
First of all, diagnosis agala at the time. After diagnosis, you should have a treatment. Some of the diseases don't have treatment. At the end of treatment, whether surgical, medical, it should not be too complicated. At the end of the complication, you should have a cure. At the end of the cure, I should be able to get back to my life. All diseases don't go like this. This is one of the few things you can actually manage correctly. You can actually go through this whole thing and reasonably. See about driving. My son is 24 years old. He doesn't even care to drive. So now this generation, they don't want to own cars. They said, where to park, where to do, where is garage, where is this? So we'll hire. So we have enough things. So life is changing. So don't think that just because you can't do one activity, you are paralyzed. Guys, there are different ways to run life. Alva.
That's what
If
I'm
I
telling.
when I went to Japan to study 6 months fellowship, I was riding cycle or I was taking the public transport. So you have to adjust to circumstances. So if you have an epileptic, you say somebody has to sleep well at night. How do you tell him to manage night duties? What is your advice?
See, sir, the job modification is very difficult in our setup because job surety is not there for most of the patients. Okay, if they are in government service, then job modification they will give. Okay, but in private setup it is very difficult. Okay, that's why I tell many patients to hide the epilepsy from their colleagues because they think they are less efficient. It may interfere with their work. So ideally, whoever is having seizure, especially sleep deprivation is causing seizure for them, ideally they should avoid night shifts. There is no second thought in that one. Okay, I will tell the patients, I know I can understand your situation, but the thing is, you see, to lead the life is more important.
Agreed.
Okay, if you end up in seizures and if you have accidental injury, then you may be bedbound for a long time. Okay, so from that aspect, you stop night duties. Many patients I will write and give, avoid night shifts.
Correct.
Okay, avoid night shifts I will write and give. Many times when I write avoid night shifts and I give certificate, people will tell, sir, they will come to know I am having seizure, sir. Even if you don't give certificate, also no problem. Okay, that much stigma is attached. Okay.
So risky. That's why the people are willing to put their life at risk for all this. Guys, don't do that. We are willing to give certificates, not illegal certificates. It's all legal that we can give. So you have to find ways. But there are enough companies which respect that right now and do different adjustments. You have to find that. Very, very important. So compliance. The other common things when I give anti-epileptic, any medicine that I give, the common thing is, sir, this medicine you're giving 1 gram. This is only 10 milligrams. You give more of this, sir. Don't give me this. This is too strong. Power tumba jasti de, sir. Anta. So why are some medicines having different mgs, Sridhar? Can you educate our audience about?
100 gram iron, 100 gram cotton, which one is big?
Cotton is bigger.
Cotton is bigger. Which one is heavier?
It's the same weight, no?
It is same weight. But to look, it looks very big.
Correct.
Okay. See, when you are taking medications, each medication whatever the milligram you will give, one medication we cannot compare with another medication. Okay. So it is like comparing pounds with kilos. Okay. 1 pound is equal to 1 kilo, like that. If you compare, it is a wrong thing.
Correct.
Okay. Similarly, certain medications are there. In low dose, they will do activity. Okay. That is example, we are giving clobazam. Okay. So we'll give 5 milligram twice daily or 10 milligram twice daily. Very rarely we go beyond 30 milligram. Okay. Levetiracetam is there. Usually basic dose we start is 500 milligram in morning and 500 milligram in
1
night.
gram per day.
We cannot compare 500 milligram of levetiracetam with clobazam of 10 milligram. We cannot bombard with clobazam of 500 milligram. Then patient won't get up on
Correct.
Okay.
Correct.
Say the medication, each medication, the dosage, the potency, the efficiency.
Potency, I think that's the right
it is
word.
it is entirely different. You cannot compare iron with gold with this thing like that. Each has its own character.
Correct.
Okay, like that medications, levetiracetam, the dose will be different. Clobazam dose is different. Topiramate dose is different. Zonisamide dose is different. So don't go with milligram.
Got it.
Okay, don't go with milligram. If milligram is I means, it doesn't mean that you are having toxicity. Example, in Indian patient, if phenytoin is given more than 300 milligram, they will have toxicity symptoms.
Correct.
Okay, levetiracetam, even they tolerate 2 gram, 3 gram, they will tolerate. Correct. Okay, we cannot tell, sir, phenytoin you increase further because you are giving 2 gram. You will end up in toxicity symptoms. That's why we won't use phenytoin more than 300 milligram orally. I am telling, not about loading doses, orally, like that. So the milligram of each medication, don't compare one medication with another medication. That is a different game.
And one more thing I will tell you is, you don't worry about that. Leave it to them. Leave it to us. We know exactly which medicine can be given, which in safe dose, because we have your interest in mind. We know exactly how you have to tolerate and things like this. The second question people
One more thing, whenever patients tell side effects, I will always tell, okay, see, whenever I'm giving medication, I am also more worried about side effects.
Correct.
I make sure that whichever the possible way side effects will come down, or they are having least side effects, that kind of thing only I am giving. Nobody purposefully will give medication to increase the side effects. Nobody want to suffer you.
Correct.
They will make you to more suffer. Doctor is there to decrease your suffering. Okay, so that's why I am called doctor. Okay, by thinking I may decrease your suffering. Okay, why I will make you to suffer more?
Exactly.
Okay, always my intention is to decrease your suffering. Sometimes side effect may occur. Even if occurs also, we can revert it. Most of the time side effects will be reversed with modification.
Every medicine is safe, but in some subset of patients, it may not agree with them. You understand? Like some food doesn't agree with some people, like groundnut allergy or whatever. So the moment that happens, you come back and tell your doctor, they will change the medicine. So that's how we have a set of medicines that we do. We will do that, and that's the key. The second question people commonly ask, the myth is, if I take medicine long time, what is the side effect? What is the risk? 3 years, 5 years, so everybody is scaring me.
See,
what to do? What will you answer them? These questions?
I tell them, okay, so the thing is, whatever the medication we are giving, especially in modern medicine, whatever the medication we are giving, they are tested medicine. So they are, before coming to market, so much trials is going on. Animal trials has undergone, human trials has gone, and we will be knowing each medication in detail.
Correct.
What is the half-life, where it is excreted, how much concentration it will be there in the body, what is the toxicity symptoms, if toxicity symptoms occurs, how we have to treat, everything we know. So we are having evidence. Okay, so whichever the medication, why we people will tell side effects? Many people will tell, sir, for everything you will tell side effects, sir. Because I will tell them, you see, it is searched. Okay, it is so much research has been done in this one. That's why we know side effect is there. Okay, when you are telling benefit, side effects also we are telling. Okay, so everything is tested thing, everything is having data. Okay, so most of the anti-epileptic medication in long term, they won't cause any major problem. Okay, so you can discuss with your
you are taking for
in
years.
juvenile myoclonic epilepsy, all those things they will take lifelong.
Exactly.
Nothing will happen. Okay,
I agree.
So no need to worry about that thing. In lifelong taking of treatment, usually nothing will happen. Okay, you can follow up with neurologist or your clinician. You can discuss with them. Okay.
So before I go to epilepsy and pregnancy and medicines, I want to talk to you about your training. Did you want to be a doctor from your childhood, or what did you want to be?
I wanted to become Kannada teacher.
Kannada teacher? Are you serious? How that?
Yes.
Oh, that really made it the route change. You got it wrong bus, huh?
No. See, your expectation depends on your financial status and cultural background. I am from my village. My father is primary school teacher. Role model for everyone is his father. Okay, so my father used to have peaceful life. Okay, primary school teacher. And in village, everyone will give respect to master. Mestre. All panchayati, all these things they will call them. Okay, so that is the feeling we'll be having. Everyone will respect you. That was the time. It is 30 years, 40 years back, I'm telling.
I agree.
Okay, that is the concept I had. Okay, but later over a time, okay, so I developed interest more in biology. Okay, and yes, I had good score also. Okay, so finally, instead of doing TCH, I did MBBS. Now also that thing is there in my mind.
ಹೌದಾ?
Okay, I am happy with the doctorate because always I tell my wife and my colleagues, God has given everything for me. Okay, so if you ask, He may not give. If you don't ask, if whatever you want, He will give. So many things, many times it will happen. We don't know what to ask.
Correct, correct.
Today, whatever we are asking, tomorrow it may not be correct. So God knows what to give. Okay, there's one kagga is there for that thing. ಹೊನ್ನೆಂದು ನೀ ಕೈಗೆ ಗೊಂಡಿದನು ವಿಧಿ ಮಣ್ಣೆನ್ನುವನವನು. ಹೊನ್ನೆಂದು ನೀ ಕೈಗೆ ಗೊಂಡುದನು ವಿಧಿ ಮಣ್ಣೆನ್ನುವನವನು, ಅವನವರ ಮಣ್ಣೆನ್ನುವೆ ನೀನು. ಭಿನ್ನವಿಂತಿರ ವಸ್ತುಗಳ ಮೌಲ್ಯ ಪಣ್ಣಕ್ಕೆ ಗತಿ ಎಂತು ಮಂಕುತಿಮ್ಮ. That means many times we feel like this. ಹೊನ್ನೆಂದು ನೀ ಕೈಗೆ ಗೊಂಡುದನು ವಿಧಿ. We thought that it is having gold, this is having high value. We have purchased something.
Correct.
But tomorrow morning that it may not have value. Example, one god came and gave you 100 crore rupees in cash. Overnight demonetization happened. Okay, I will tell this thing to you. See, God came, okay, and asked, oh, hey, Dr. Shreedhar, or whoever is, hey, what do you want, man? So there are two ways. Whatever you feel good for me, you give that thing. Or I have to ask. Then I asked, God, you give me 100 crores. Cash. Okay, so I gave cash. Overnight demonetization. God has told me already, only one time I can give boon. Okay, next day demonetization happened. Whatever 100 crore is, 2 kg paper.
Okay, 2 kg paper.
If I would have asked God, it is your wish, then he would have given 1 hectare land near Devanhalli airport.
I like that. Kerala would have worked there. Application.
Then you would have given 1 hectare Devanhalli airport.
Correct,
Okay, it would have yielded me so much money.
I agree.
Okay, that's what I'm telling. ಒಂದೆಂದು ನೀ ಕೈಗೊಂಡುದ ವಿಧಿ ಮಣ್ಣೆನ್ನುವನವನು. Okay, whatever the value you think which is, it is having high value, tomorrow value will come, it may not have value. ಮಣ್ಣೆಂದು ನೀ ಕೈಗೆ ಗೊಂಡುದನು ವಿಧಿ ಒಂದೆನ್ನುವನವನು, which is not having any value. Outskirt of Bangalore, so there was no value of them. There was no real estate business 30 years back. Now what is this thing? The people have purchased 30, 40 site, 40, 60 site. Now what is the value? ಮಣ್ಣೆಂದು ನೀ ಕೈಗೊಂಡುದನ್ನು ಒಂದೆನ್ನುವನವನು. ಭಿನ್ನವಿಂತಿರ ವಸ್ತುಗಳ ಮೌಲ್ಯ, the value of particular thing, the subject or whatever the movable or immovable property, whatever the value is there, today value may not be there for tomorrow. Tomorrow value may not be there for today. Okay, when so much fluctuation is there in value of, how can you lead the life? Pannakke gati antu, how can we do our life vyapara?
Correct.
Okay, how can we do trade of life? Okay, that is the thing I wanted to tell.
I agree. Amazing.
So I wanted to become teacher. God made me doctor. Okay, so it is his wish. Okay, accordingly I am moving. Okay,
So what got you interested in neurology?
so I want network concepts. Okay, I am a more of clinical person. Okay, I want to listen to patient history. I want to speak more and more with the patients. Okay, that is possible only in neurology and psychiatry. Okay, so I don't want monotonous job. Okay, each patient will be different in neurology.
Correct.
Okay, so that is the thing. So till MD medicine, after completing, I had what to do next. Then I choose neurology. Okay.
Interesting. You did MD medicine in AMU, Alba.
Yeah, Aligarh Muslim University. That is the area first. I was not knowing Hindi when I entered Uttar Pradesh. Yeah, in Jawaharlal Neurological College. It is in Aligarh Muslim University. Comes under AMU. There I learnt Hindi. Okay, my Hindi is little bit mixed with Urdu. It is nice university. Okay, I had very good friends. Okay, so it was very nice experience. Okay, whenever I'm speaking with our North Indian friends or North Indian patients, many people will feel I am from UP.
Howda?
Because I learnt Hindi in UP only. Okay, so like that.
And what got you interested in epilepsy?
So the thing is, after completing DM Neurology,
Where did you do your DM neurology?
I did my DM Neurology in Shreedhar A Institute of Medical Science and Technology. Okay.
Trivandrum.
So Trivandrum, it is an institute of national importance. Okay. So as I told, history is the one thing which fascinating for me to interact with the patient. Epilepsy is completely history only. Okay. When I am spending time from morning to evening, okay, so that challenges are there in epilepsy. Okay, the humanitarian ground we have to deal with the patients. We have to counsel the patients. You are interacting with human being. Okay, so at least by my side, at least I can decrease their false beliefs, myths. At least I can give emotional support for them. That's why I choose epilepsy.
I know your patients love you. I've met a
Yeah,
lot
yeah,
of
yeah,
them,
yeah,
so
yeah, yeah.
I'm really happy for that. Good. So we come back to another very important topic, which is anti-epileptic drugs, epilepsy, and pregnancy.
Yeah.
So can you give, because there are a lot of women who are struggling in this space, a lot of obstetricians and gynecologists struggling to say which is safe, which is not safe, first trimester, second trimester, should we do, should we not do, what to look for. Can you educate our people on
You see, as I told you, if 100 patients of seizures, there 70% of patients are seizures are well controlled. Okay. Coming to pregnancy, we are having something called pregnancy registries. We are having so many pregnancy registries. In our Shreedhara, we had Kerala pregnancy registry. Similarly, in European countries also they are having pregnancy registry. Here they are following the females, okay, childbearing age group. Then they will follow them when they become pregnant also. Then they follow their children also, okay, with EEG scans and counseling, everything they will follow. So whatever the available evidence is there, especially in well-controlled seizures. Okay, so in well-controlled seizure, if they are not having any comorbidities, okay, usually fertility rate is not that much different. They can normally conceive. They can have normal babies also. Even normal delivery also they can have. Okay, sometimes they may having comorbidities. Some things, hormonal imbalance, all these things. So they have to meet the gynecologist.
that? Can happen
In most
anytime.
of the patients, okay, in well-controlled seizure, there is no issue with pregnancy. Then coming to medications, because we tell the pregnant female, don't take any medication. Whatever you take, it will go to your child. That is a common thing we tell for everyone. Okay. So regarding the medication, say whenever you are having epilepsy, you should have planned pregnancy. It should not be unplanned pregnancy. Okay. At least you should be seizure free for at least 6 months before planning pregnancy. The one thing. Second
So
thing
that's the
is,
first advice you give them.
yeah,
Plan pregnancy, at least minimum 6 months seizure-free period.
yeah. So you should plan a pregnancy. Second thing is, in advance, okay, you have to meet your neurologist and gynecologist or clinician, whoever is there.
Even before you become pregnant.
Yeah,
Correct.
because you see, there are so many medications are there. Example, patient may be on valproate, topiramate, phenytoin, phenobarbital. These will increase the risk of birth defects in babies.
Birth defects. Yes.
So whenever they are on this kind of medication, we have to modify the medication with newer generations and safe drugs.
Which is safer drug.
Okay. So example, levetiracetam is there, lamotrigine is there. So in those kind of drugs, we have to modify. Or if any medication, if you are decreasing the medication which are causing more side effects, if you are whenever decreasing the dose, if they get any seizures, we have to give lowest permissible dose of those medications, so that to prevent to decrease the severity. So always I tell before planning pregnancy, so they have to go to clinician or neurologist, modify the medication. They should be seizure free for 6 months. At the same time, she has to meet the gynecologist also, and all the patients. Okay, nowadays any female who is planning for pregnancy, they should have folic acid supplementation. In seizure patient, is very important. At least 8 to 12
More
weeks.
important.
Very important. At least 8 to 12 weeks prior to planning pregnancy, they should start folic acid supplementation.
I just want to stop you here. Folic acid, he's saying, is one of the B complex vitamins. Now, it's 6 paisa?
Less than 1 rupees.
Less than 1. I think it's, I don't know, some less than 1 rupee. But you know, if the pregnant woman does not take the folic acid right from the first couple of 1 or 2 weeks of pregnancy, they develop brain or spinal cord defects we call it neural tubal defects. See, the neural tube where the spinal cord goes is normally open when it starts. It closes in 8 weeks of pregnancy. So this folic acid helps in this closing. So others, what happens is some of them are born with big heads. They have a bump in the back, the bump in the lower back. They have, brain is not developed properly. Spinal cord, they'll be paralyzed at birth. So many things are going on. But problem is, even yesterday I saw a child with a neural tubal defect.
Yes, yes.
Yesterday, and the child is 18 months old. I'd seen a childbirth. I have to operate the child now. So I tell, and I was giving a talk once in Vanivilas Hospital. I said the problem with many gynecologists, they don't see the child after that. We are stuck with the baby. So the only way to eliminate neural tubal defects from the face of this earth, WHO says, World Health Organization.
At least 8 to 12 weeks prior to this.
They have said any woman from menarche to menopause just take folic acid every day, because majority of the pregnancies are unplanned.
Correct.
And by the time they realize they are pregnant, it may be 6 weeks, 7 weeks. They keep postponing. They figure out for different reasons, uneducated, whatever it is. Anyway, so it's more important for folic acid in
And
anti-epileptic drugs.
one more thing I want to tell when we come across unplanned pregnancy like this. So there are certain medication. Normally, family planning will be there. They may postpone the pregnancy. So we are having different method of postponing the pregnancy. There are barrier methods are there. Oral contraceptive pills are there. Carpet, all these things will come. So especially certain medications are there. Example, valproate is there, phenobarbital is there, phenytoin is there. All these things will interfere with oral contraceptive pills. Okay, we call something called oral contraceptive failure. Even though they are taking oral contraceptives,
they still
because
getting pregnant.
because enzyme inducing drugs we call. Okay, especially this phenytoin, phenobarbital, all these, the enzyme induces. They will accelerate the metabolism of oral contraceptive pills. In spite of taking, they can become pregnant. So you have to meet your gynecologist or neurologist. You should ask safe methods of family planning. In those patients, in this kind of medications are there, the OCP effect will come down. It is better to use barrier methods in those patients. That is very important.
Next question to you. So, assuming that all precautions have been taken and the woman has had a planned pregnancy, you have those usual 3 trimesters, first, second, and third. In these 3 trimesters, when is the seizure risk the highest? Is there anything like that?
See, pregnancy as per it doesn't increase seizure risk.
Okay.
Okay.
That's a good point.
The only thing is pregnancy is a physiological change.
Correct.
Okay, by second trimester they will gain more weight. Okay, so per 50 kg what is the medication dose you are giving? Per 65 kg it may be insufficient in certain medication, not in all the medication, in certain medication. So you should make sure that in second
dosing
trimester,
is appropriate.
in second trimester, accordingly with respect to your body weight, you have to increase the anti-epileptic medication. That is a more important thing. And second thing is anomaly scan. Nowadays we are having so much advances in anomaly scan and screening of inbound error of metabolism or congenital anomalies, all these things. You have to meet gynecologist in timely manner, and you have to get anomaly scan, whatever the blood test they tell, to screen the defects. You have to get
Any
it done.
defects, birth
Okay.
defects.
That is very important. Okay.
And,
So
more than normal. Anomaly
I-
scan is done normally in every pregnancy, but you have to pay more attention here.
yeah, that is very
So
important.
You have to terminate the pregnancy. And
Yeah.
termination is 24 weeks. That's the cutoff, I think. I'm not so sure about that. Anyway, so that's the second question. And why is it so important is one seizure can cause, so much of chaos during pregnancy.
Yeah, the thing is, as I told you, there's 2 types of major seizures: big seizures, small seizures. Okay, usually if hypomotor seizures comes, okay, yeah, usually they won't cause much problem unless you fall in prone position and injury to uterus and these things. If they are sitting at one place, they may not cause much problem. But if you are having generalized tonic-clonic seizure, because vigorous pressure is creating, sometimes miscarriages can happen. If your seizure is prolonged, the placental circulation may come down, hypoxia can occur for the
Child may
baby.
have
So
oxygen.
it is very important to take the medication properly. And regarding, many patients will come and ask, sir, shall I go for LSS delivery or normal delivery? So whatever the classical teaching for we people, so delivery, if there is no contraindication from gynecological side, they can go for normal delivery. There is no problem. Okay, unless patient is having more recurrence of seizures or patient is having poor controlled seizures. In those patients, they will take a decision. Okay, so normal delivery in a well controlled seizure patient. Okay, if there is no gynecological contraindication, no issue.
But I think it's preferable to have it in a hospital which has a neurology backup just in case something happens.
Yeah.
I think there's always a safety at the end of the day.
And one more important thing is, so what it is my observation, pregnancy, as I told, it doesn't increase much. It won't increase seizure risk if you are optimizing your antiepileptic medication. Seizure risk is more common after delivery. Okay.
Oh,
yeah.
okay.
It is my observation.
Okay.
Breastfeeding mothers will be there. Child will be very small. Okay, it will be frequently getting up. So sleep will be inadequate for the females.
Sleep deprivation.
Okay, especially if it is not a combined family. If it is a nuclear family, that social support system will not be there. Okay.
So we have to warn them about that.
Yeah. Kids will be getting up so many times in night.
Correct.
Okay. And second thing is there will be hormonal fluctuation will be there. So much emotional ability will be there. Okay, suddenly progesterone, it was high, it has gone down. Okay, so after delivery, so much hormonal fluctuation will be there, having so much emotional ability, anger outbursts, this emotional stress is also there. Okay, so I always tell the patient and nurse, okay, so make sure that somebody is there with you always. Okay, first thing. Second thing is, whenever you are feeding the baby, don't sit in chair like this and feed the baby. You sit on the floor or cot where there is enough space is there
Even if you
with
fall.
bed. Even if you drop the baby also, you should it should not fall on
Injured,
ground.
correct.
You should just slip over the bed. You should not injure the baby.
That's a good point.
I have seen many patients, especially myoclonic jerks patients, because they are not sleeping properly in spite of medication. Suddenly can jerk like this.
And the
They
baby
can drop the
fall down.
baby.
Correct.
Okay, always I tell them, don't handle the baby till it little bit matures. Okay, and while walking or while taking the baby to bathroom, all those things, tell your husband or your mother to take the baby to bathroom, and make sure that when you are giving bath to baby, one person should be there. When pouring the water, suddenly if any seizures comes, so we have to anticipate.
Correct.
Once
It's a very
problem
valuable-
occurs, okay, there is no use
Correct,
of
there's no
regretting.
point. Correct.
Okay, I will always tell them that this thing I will tell. And certain patients, in spite of adequate control, they may have seizures also. Okay, in these individuals, I will tell, we tell commonly kangaroo care. So the baby has to sleep near to the mother. That is called kangaroo care.
Correct.
But especially in generalized seizures, if they are having risk of seizures, the rollover over the baby is very common in sleep. I will tell always, you place the baby in cradle but with adequate insulation, so you should not suffer from cold. So with adequate insulation, so that, because baby will be in 2.5 kg, 3 kg, 4 kg.
Correct.
If you are in GTCS, if you roll over the
Correct,
baby, it will be
correct,
asphyxiated.
correct.
Okay, so all these instructions usually I will give for all the
And
patients.
okay. These are valuable information.
That is
even for the
very
gynecologist.
important.
Yeah,
And
obstetricians,
some patients, in spite of the medication, they can have seizures. In those certain patients only told me, this is the idea they given by patient. Sir, what we will do is at 11 o'clock I will express my breast milk and I will keep, sir. If baby is crying, my mother will give, sir, express breast. That is also one good
That's
option.
a good idea. That's what you have to mentally prepare them so that they'll get a plan B.
Yeah,
which is
see,
safe. Yes,
this was this wide idea was told by patient. Okay, so sir, my jerks will increase, sir, if I won't sleep properly. So 11 o'clock I will express my breast milk and keep in refrigerator. Whenever my kids get up, my
That's a
mother
brilliant
and
idea.
husband will give this thing, sir.
So
In
I'll see
my
them.
morning again I will
I'll
get
be
up this
correct,
thing, sir.
correct.
This was told by patient.
Very
That is
good.
also correct one.
I agree. I
Many work going women will do same thing. At 3 months they are leaving the baby and going for work.
Yeah.
Okay, so they are doing same thing. Okay, that was told by
I
patient.
think that's a good idea. That's a very good idea.
Yeah.
So there's one more interesting article. Our colleague and good friend Dr. Thomas Matthew from St. John's, published this article on the eucalyptus oil.
Yeah, eucalyptus oil.
Oh, Thomas, that was crazy when Thomas produced that. So what is about that article? You tell us about that story.
You see, most commonly we use bombs. For everything we will apply bombs here and there. Everywhere we will apply bombs. So one of the ingredient is eucalyptus oil.
Correct.
I will always tell my patients, whenever you are applying some bombs, you see whether eucalyptus oil is there or not. We are having some tradition where this eucalyptus oil containing bomb will put to water and they will inhale the steam.
Correct.
Okay, they eat the water and
I have
steam
done that
inhalation.
so many times myself.
I have also done previously. Now I am not doing that thing. So whenever you are having a low threshold per seizure, okay. So when you do eucalyptus oil inhalation, so you will get seizures. So that is a series published from St. John's, St. Thomas, sir. Okay, eucalyptus oil induced seizures, sir. Okay, many patients will have that.
Chewing gum, eucalyptus oil. Can you imagine, guys? It can come anywhere, anyhow. We're not scaring you.
But
Please
after
understand.
that thing, when we search the literature, okay, so there are some reports. Eucalyptus oil they use for floor cleaning. Okay, to have good smell. So small infants crawling over that thing.
Oh, very close.
But skin absorbing the eucalyptus oil absorbing and inhalation itself has caused seizures in infants also. There's case reports are there.
So all we are saying is, you don't say stop this, do this. Don't get paranoid. Don't become an OCD. All we are trying is be aware of it so that in a particular situation you can avoid certain things so that you minimize the risk, because the seizure at the wrong time, like we said, can be, technically life-threatening.
Little modification is required in
Yes,
lifestyle.
that's a lifestyle.
Okay,
lifestyle.
and lifestyle modification required is least in seizures.
Now that we went through pregnancy, now you told there was still 1999 there's a very scary act in the Indian law. What is that act now? Can you tell our viewers about that? Just to know that as recently as to 1999, what was the way epilepsy was being looked even in the legal profession?
The thing is, so Marriage Law Amendment Act. There are
Marriage law.
marriage law.
Hmm.
For everything we are having law.
Hmm.
Okay, Marriage Law Amendment Act in 1976 is there. 1999 is there. Till 1999, okay, insanity and epilepsy together were considered as one of the reason for nullifying the marriage.
Nullifying?
Dissolving the marriage.
My
Okay.
goodness.
Okay, because of a constant effort of Indian Epilepsy Society, and many people were concerned with neurosciences, okay, and with good lawmakers. Finally, that they brought changes to that act in 1999 Marriage Amendment Act. Epilepsy was separated from insanity. Nowadays, epilepsy is not a reason for dissolving the marriage.
Or seeking divorce.
Yeah. Epilepsy is not a reason, because epilepsy is a controllable disease and it is curable disease also. Okay, so nowadays epilepsy is not a ground for dissolving the marriage. That is, so we have to give credit to our politicians. They have brought the amendment,
and also the doctors who
and
tried
Indian
it.
Epilepsy Society
Indian
and
Epilepsy
doctors or paramedical medical staff or general public. So they supported this thing.
Correct.
Okay, we have to appreciate them.
Absolutely, I agree. I agree with you. Sridhar, if we keep on talking, there's so much more to talk, I think. But I think we have covered most of the major areas of what is going on. I think we have given our public a very good view of what it is. Before we wind up, I want to tell them about all the myths that are there in epilepsy. Idmadi, Admabadi, there's so many things that's going on. What are the common myths that you hear?
Yeah.
And what do you want to break any of these myths?
Yeah.
Please tell us.
Initially, when the conversation was started, I was telling knowledge, attitude, and practice.
Correct.
Knowledge means how much you know genuine things, truth about the disease.
Correct.
Okay. So epilepsy is the most misunderstood disease in mankind. Okay. First thing is, epilepsy is a mental illness. That is a wrong thing. It is like any neurological disorder. Second thing is, all the epilepsies are hereditary. That is also wrong. I told you, if 100 patient comes, 90% will not have any family history of seizures. Third thing is, epilepsy is a contagious. That is very wrong. It is not a spreadable disease.
Correct.
Okay. Fourth thing is, they cannot have normal life. That is also wrong. Okay. They can have normal life. They can marry. They can have baby. They can rear the babies also. Fifth thing
they
is,
can go to work. They can do. We have CEOs of companies who are epileptics and doing very well.
Yeah. Fifth thing is, they are inefficient at work. No, they are good at work. Okay. Even they work more than whatever is needed. They are efficient at work. Okay. And sixth thing is, many people still believe, especially in rural settings, it is a sins of previous karma. Okay. That is not true. It is a disease which is having pathophysiology. Okay. Nothing to do with whatever you have done in past life. Okay. This is the thing. And coming to attitude of the people, this is knowledge. Then comes attitude. What is the attitude of the people? Discrimination. That has to be avoided. Okay. He is like any other human being. He is having diabetes, you are going with him for chai. He is having kidney disease, you are going with him for dinner. But if epilepsy patients want to come with you, you will be thinking, okay, how can I take him? If anything happens to him, like that you will be thinking. Don't worry all those things. Okay. So we have to consider him as other human being. The only way you can support him is by inclusiveness. Okay. Don't discriminate them either in workplace or in social gathering. Okay. You should encourage them. You cannot discriminate them. Okay, this is the thing. That is the attitude. Okay, and practice. When come to practice, okay. So whichever the system of medicine is there, some people may like modern medicine, some people may not like modern medicine. All these things, issues will be there because it depends on person to person. Meet clinician. Okay, take treatment for epilepsy. Don't neglect it. Okay, because in Kannada we tell ugurigu ಓದ್ಕೆ ಕೊಡ್ಲಿ ತಗೊಂಡ್ರು ಅಂತ. That means that thing which can be removed with your pinch, you are taking axe to remove that thing. Okay. Initially, when seizures are onset is there, if you control, it will be very well controlled seizures. What will happen if you don't control seizures initially? what will happen? It will go on increasing in frequency. I will always give, many patients will tell, sir, 4 ಸರಿ ಅಷ್ಟೇ ಬಂದಿರೋದು, ಇನ್ನು 5ನೇ ಸರಿ ಬಂದ ನೋಡ್ಕೊಳೋಣ ಸರ್ ಅಂತ ಹೇಳ್ತಾರೆ. So I will give an example for them. Okay, so usually in seizures what we will do is, so a patient is having single episode of seizure, if he is not having any family history, if sibling is not having any history, if it is not a nocturnal seizure, okay, and if MRI brain is normal, EEG is normal, okay, then chance of having seizure in next 2 to 5 years is 30%. Okay, so if that person is able to take care of himself, if he is doing office desk job, then we can tell him you wait for second episode. If EEG is abnormal, MRI is abnormal, sibling is having seizure, strong family history of seizure is there, EEG is abnormal, even and reflex epilepsy is there, even single seizure is an indication to start anti-epileptic medication. I always tell why we have to start anti-epileptic medication. You say you are having one bag full of tomato. Okay, so one tomato is rotten. What you will do? You will take out that tomato and will throw.
Correct.
What will happen? Otherwise, it will infect other tomatoes. In brain, we cannot do. There are abnormal electrical activity producing neuron is there. We cannot take it out. We can suppress with antiepileptic medication. Only if it is refractory, then only we can take it out. Okay. So that person is there, he is sitting inside. Okay. He is producing abnormal electrical activity.
Thorough circuit.
Thorough circuit. If you don't suppress him, he will recruit another neurons.
Correct.
Other neurons he will recruit.
Bara.
That is we call kindling. Correct. Many times it will happen. Patients was having generalized seizures for 10, 20 years and 30 years of age he is having temporal lobe epilepsy, because that fellow was in frontal lobe sitting, he is producing generalized tonic-clonic seizure. Because of his influence, temporal lobe has become scarring, he has developed mesial temporal sclerosis, he is producing hypomotor seizure like this. Those are kindling. So the controllable seizure becomes uncontrollable seizure now. Okay, that is very important. Okay, so early treatment is very important.
Very good. So we have a couple of more things to talk on. So first is, we all spoke about diagnosis. What if a seizure happens?
Yeah, that is more important.
So what are the do's and don'ts?
Yeah. So
especially if it's a GTCS.
Yeah.
Or any seizure.
Yeah. First I will tell generalized tonic-clonic seizures. Okay. Always we tell the patient 3S, 2N.
3S and 2N.
2N. Okay.
S.
Yes, 3S. S for sweet. Seizure. Okay. First S is stay with the patient. Whenever he is having seizure, don't go away from him. He may end up in fall. Example, whatever the train incident you showed, if somebody would have with him.
Correct.
Okay, they would have saved him.
Correct.
Okay, stay with the patient. Second thing, safeguard the patient. Okay, example, I am having seizure, I am having specs. Suddenly, I may beat my specs and the glass thing can enter in eyes. I may end up in blindness.
Yes.
Or I may be having tie. Okay, it is very tight. When I am doing like this, it may cause suffocation. So, if anything is there, safeguard the patient. Or when I am falling like this, some edge of the chair is there, you take out that chair. Okay, so safeguard the patient. Okay, when patient is having abnormal movement like this, don't turn the patient. Because many people having habit of, when patient is shaking like this, if you turn the patient, what will happen? Shoulder dislocation is very common, because you are rubbing shoulder. The shoulder will be rubbing about the ground. One thing. Second thing is, I have seen one patient, so in tar road he has seizures in the road. So they turned him. So because he was moving like this, his face was also moving like this. He had great 2 to 3 ulcers over the ulcer of face because of rubbing over the tar road. Okay. When you are seeing that patient, at either place jacket below the head. Okay. Once seizure subsides, turn the patient to either right lateral side or left lateral side.
With the face down.
So right lateral side or left lateral side, so that whatever the saliva is collected, it will come out.
And don't go into the lungs.
Yeah, don't go into the lungs. This is 3 things. One is stay with the patient, safeguard the patient. Once abnormal movement subsides, is sent to left side or right side, whichever the side is there. Okay, these 3 things. 2 N's are there. That's very important. Okay, so rather than benefiting, you may do harm to the patient.
Okay.
First thing is not restrain. Do not restrain.
Don't hold the hand.
Yeah, whenever patient is having seizures like this, 2 people will sit on the leg, 2 people hold the hand like this. Say they are having elephant power at that time. So much muscles are contracting without any regulation. So how much pressure you put, that much pressure they are exerting. So you end up in soft tissue injury, fractures, okay, joint damage, Okay, finally when they recover, they will be having so much pain in the body. When it occurs naturally, that much pain may not be there. If you resist, the pain will be more.
Correct.
That is the one important
So
thing.
what is that? N is what?
Not restrain. Do
Not
not
restrain.
restrain.
Ah,
Do not restrain. Okay. Second thing is not to put anything into mouth. That is very important. Everyone is having habit of keeping their fingers, spoons, kerchief, everything they try to poke into mouth. Okay. You see, I will ask me, why you did like this? Sir, to prevent tongue bite, I did. You cannot prevent tongue bite in generalized tonic-clonic seizure. At the onset only, the tongue would have deviated and it was bitten. You cannot do that thing. You cannot prevent. Okay. By doing that thing, you are harming the patient, not benefiting the patient. When you are introducing spoon or you kerchief anything, you may damage the tongue or you may push the tongue backwards. It may arrest the airway.
Correct.
Okay. So don't do that thing. Okay. This is the important thing. Then one more thing is timing. Okay, so onset of seizure, then end of the seizure. Usually, most of the seizures, 99% of the seizures will subside within 1 to 3 minutes.
Self-limiting.
Self-limiting. Okay, they will regain the consciousness after 15 minutes. Most of the patients, by 15 minutes, they will regain the consciousness. And one more thing I want to tell, one more N we have to tell. The thing is, some patients, whenever they are having seizure, they will try to put salt water into mouth, sugar water into mouth. Even if he is having hypoglycemia, when he is having recurrence of seizures, if you put sweet water into mouth, it will go to lungs.
Correct.
Okay. Rather than dying because of epilepsy, will die because of aspiration pneumonia and asphyxia.
Correct.
Okay. So you should take care that, okay, the seizure subsides. Okay. After once he become conscious, okay, speaking very well, then only you should offer something to improve mouth. Okay. Okay. The one thing. And second thing is timing is also important. Sometimes very rarely seizures may prolong. We call something called status epilepticus. If it is prolonged for more than 5 minutes, okay, so that kind of patients immediately it has to be shifted to hospital. There are some indications. Immediately when we have to rush the patient, elderly individual is there, pregnant female is there, any seizure is lasting more than 3 to 5 minutes, or seizure, recurrent seizures are occurring. Okay.
Continuous, one after the
one after another one it is
cluster
occurring.
attacks.
Cluster attacks. Or because of seizures, he has fell down and he has injured himself. And any external visible injuries. All these things is an emergency. You should take immediately the patient to the hospital. Okay, that is very important. From patient aspect, I want to tell all the patients. Okay, many patients will not tell I will tell all the patients. Whether you are working in office, whether you are in school or wherever you are there, you will be having one close friend. Yes, no? At least for that close friend, you take into confidence and at least reveal you are having epilepsy for them. Okay. If anything happens, at least they will be knowing.
One person knows about.
One person knows about that thing.
History.
Okay.
And the medications they take.
Yeah. So in many.
So in the West they wear the band.
Yeah.
So that the band is there. Yeah.
Band is there, but our patients will think if band I am wearing, people will think I am having epilepsy. Okay, it is an identification thing, stigma. So for children, parents, I will tell. At least class teacher you tell he is having this problem. Okay, no sir, if I tell class teacher he may not concentrate on my child, he may not give much homework to him. No, you tell him, you treat him like any other child. If any problems occurs, what are the first aid to be done? You tell the teacher. Nowadays, especially in city setup, urban areas, most of the schools, standard schools are having nurses, all these things, and many teachers are trained in first aid, all things. But in rural areas, we don't have that thing. Okay, so you tell them. Okay, and I will tell, and you treat your child as another child. Example, 2 children are there. One sibling is having seizure. You have to give same support. How much support you are giving for that first child who is not having anything, same support you give for this child. Okay, no need to show that too much leniency.
Correct.
Okay, no, he is having seizures. I will not stress him for reading all. Most of the children will
actually do harm for them.
Because you see, child age is will be not having any importance about education.
Correct.
They want to enjoy the life.
True.
Okay, we were also like that. When my father used to have stick in hand, then I used to go and sit and read. Okay, so the thing is, if seizures are well controlled, in most of the children, if the intelligence and everything is normal, they can read like any other children.
I agree.
Okay, no need to be so much lenient. Okay, my son will have more stress if I make him to read more. Nothing like that. You don't make lazy by showing extra caution to him. Okay, you should take precautions.
Correct.
You should sleep properly. You should take medication in proper time. The stimulus should be avoided. But it should be like any other child. Okay, this is the thing I will tell, because he will be not knowing, he will take extra advantage. Okay,
True.
I
Yeah,
would also
everybody will
taken
do.
same
Every
advantage.
human being will do that.
Everyone will, because they will be not knowing
Yes,
intensity, what is the importance of
and the
education.
impact also, the long-term impact.
Long term
Then they'll blame the parents. They did
Yeah,
like
yeah,
this for me and
yeah,
they have
yeah,
no future.
yeah.
See, my brother is here, I'm here.
Yeah.
But one more thing, there is this midazolam spray that comes. How effective is that? Is there a good solution to give known epileptics so that they can? They ask us, sir, manel bandra bere en ಮಾಡ್ಬೋದು? Can I give any
See,
medicines? They
the
ask.
thing is,
So
in those patients who are having clustering of seizure, especially in children.
I was just
Okay.
going to say that.
Yeah, in adults we won't use much. Okay, in children, especially if clustering of seizure is there they will give midazolam nasal spray, sir. Okay, to abort the events. Some people use rectal rectal diazepam also. The people use.
So that is the next thing that we had to talk about. Now the last segment.
And one more thing I wanted to tell is, all the epilepsy patients I tell, even if you are not wearing band also no problem. At least you write you are having a seizure. Okay, and in case of emergency, whom to contact. Just to at least card that thing you
And
keep
also
in
which
pocket.
medicine they are taking.
Which medicine you keep in pocket.
Correct.
At least once patient falls down, somebody will search pocket to know the identity. At least they will be knowing he is having, they will immediately call the whoever the first person is there, they will call them.
No, we have had the problem because the officers brought the patient to the hospital. Which medicine, they have no idea.
Because
so we are giving the wrong medicine, loading dose. He is taking some other medicine. We are breaking our head. What is going on?
Correct. Example, patient was on levodopa system. He is having breakthrough seizure. Usually we load with levodopa system.
Exactly. So Shreedhar, there's one more thing called SUDEP, SUDEP, which is related to epilepsy. What is SUDEP and why should we be careful about that?
See, SUDEP by definition, sudden unexplained death in epilepsy patients.
Sudden unexplained death.
Sudden unexplained death in epilepsy patient.
Does it happen in sleep or it can happen at any time?
So many hypotheses are there. Most commonly it occurs in sleep. Sudden unexplained death in epilepsy patients we call. It is as such very rare. Don't get frightened by listening that word. But you should know that thing. So that is important. Okay. It is relatively common in those patients who are having long-standing epilepsy, not well controlled with medication. They are having recurrent seizures, and recurrent seizures in sleep. Okay, these are the patients who are more prone. Okay, the hypothesis, so many hypotheses there. One of the hypotheses is, whenever they are having seizures, they may be having desaturation. Because of death, then death would have happened. Second thing is, because of the electrical activity in brain, some cardiac arrhythmias, that change in the rhythm of the heart would have happened. Because of the they may ended in death. So there are so many hypotheses there. So you should know sudden unexplained death in epilepsy patients, but you should not frightened by that thing. Okay, because ula bidukundange antivno tale olage. So patients will be thinking same thing. Even on well controlled seizure patient also thinking about that thing only.
Correct.
A husband or a wife is also thinking about that thing only. It is very rare. Okay, we don't want to frighten you people with that entity, but that entity is there. But it is very rare when your seizures are well controlled with medications.
So one last thing connected with this I want to tell them is about epilepsy in sleep. So there are many times the seizure happens in sleep. So if you are living alone in a PG somewhere, you don't even know, there's no eyewitness, you have had a seizure in the sleep, you have forgotten. Morning you wake up with severe body pain, some pains here, and you have some cut in the tongue, you wonder what happened, mouth ulcer and things like that. And when you come to the doctor, if you go to a general doctor, this is the information for the doctors also. Remember that body pain, some disorder on the tongue, he doesn't know what is happening. Please suspect an epilepsy. Especially ask them the history. Did he soil his clothes? Did he pass urine in the bed or something like that? That can be the indirect indicator of that. But otherwise, it's better to be informed than neglected. So the last segment we have not covered is drug-resistant or medically intractable epilepsy. So, can you tell our audience of when do you call it medically intractable or drug resistant or poorly controlled or whatever the phrase that?
As I told initially, 70% of patients can be well controlled on medication.
Correct.
There are 30% of patients we are not able to control with medication. There are certain things are there, epilepsy surgery, there vagus nerve stimulation, so many things are there. Out of that, at least 2/3 can be controlled.
But how do you define what is?
The thing is,
I want
see,
you to tell that.
the definition is, the patient's seizure is not well controlled. In spite of 2 anti-epileptic medication, they tried in the optimal dose. We have tried them in optimal dose, either simultaneously or sequentially. Then also if patient seizure is not controlled, it is called medical refractory epilepsy. That means 2 anti-epileptic medication failure is called refractory epilepsy.
Got it.
Okay. Most of the patient, 60% of the patient can be well controlled with single medication. By adding second medication, we can continue 10% extra. Third medication, only 2 to 2.5%. Fourth medication is of no use most of the time, less than 0.5%. So when usually that's why definition is if any 2 medication is failed, it is more likely it is medical refractory.
Got it. So, what Dr. Shreedhar is saying is clearly about medical refractory epilepsy. What do we do for medical refractory epilepsy is another episode of ours which is going to come out. Don't miss that episode. Some of them, like you said, not some of them are significant majority of them do very well with different kinds of surgery, different kinds of treatments, but they have their own journey to take. That's a different episode altogether. So Shreedhar, I think we had a fantastic talk. I think we have really educated our audience. You've been very kind to tell us very, very clearly in simple layman terms exactly what at least all the major things are, how to manage those things, how to identify, importance of spending time with the patient, and the biggest thing you have achieved is breaking the myths. And it's okay to be an epileptic. We can lead a normal life. Chota mota things here and there you may have to avoid. It's like dust allergy, you have to avoid something. You have allergic to, my niece is allergic to nuts, and if she has a nut, she has life-threatening, breathing problem. She has to avoid a nut, but she's still in London, studying and doing what she's doing. So, guys, anything is fine. So, thank you very much again, and it was a pleasure talking to you. And we will take this forward. So, before I end, we have a customary thing of giving a book as a gift to all our guests. So this is a book written by us called Rebooting the Brain. So please do read it and give us your feedback and know what is happening. Any last message you want to give our audience before I wind up? Any last thing, or we have said enough of what? Anything
I think
else?
we have discussed in detail. Okay, don't do any self-medication. First thing. Second thing is don't discriminate the patient who are having epilepsy. Okay. Third thing is in time you meet the doctor, whichever the specialty you want, whichever the system of medicine you want, you meet them and take advice from them. Okay. Don't end up in accidental injury and don't risk your life. Okay. Thank you.
Thank you very much. Jai Hind.
Jai Hind.